Replenishment event. Please welcome to the stage the Mayor of Oslo, Marianne Borgen.
Mr. President, Prime Minister, Excellencies, ladies and gentlemen, please receive a warm welcome to Oslo and to the City Hall. We are honored to have such a distinguished group of political leaders, decision makers and experts in our city, working for such an important cause as the health and lives of women, adolescents and children. This building is the heart of our local democracy here in Oslo, a home to the political and administrative leadership. It is an important venue for both local and national celebrations. The most famous international celebration is, of course, the Nobel Peace Prize ceremony that takes place here in this very room every year, the 10th of December. So this is a room that symbolize hard-won achievements, but also hope, dignity, respect for human rights, respect for children's rights, and the importance of international cooperation. So in a way, this is a room for making peace. These are all values which are core to the global financing facility. So therefore, this is a perfect venue for the GFF meeting. And since 2015, this international partnership has worked to achieve better financing of health care and nutrition for women, children and adolescents in low and middle income countries. It is hard to think of an effort that is more important than that. Today, the GFF and yourselves stand before an historic opportunity to make progress towards universal health coverages. Together you can help end preventable maternal, newborn and child deaths by 2030. You can also improve the lives of millions of people and empower many more countries to build sustainable futures for their people. On behalf of the city, I strongly hope you will be able to achieve these goals and that today's meeting will be successful. The women are counting on you, the children and adolescents are waiting for your actions, and they all have great expectations. Thank you so much for all your hard work. I wish you all the best for your efforts and today's meeting. And once again, a warm welcome to Oslo City Hall. And now it is my great pleasure to introduce and give the floor to today's moderator, Lise Douchet. Lise Douchet, the floor is yours. Thank you.
Merci, thank you very much. Good morning, bonjour. Qu'est-ce qu'il y a? Vous n'êtes pas en bonne santé?
Not in good health this morning.
Conference on global health. Let us show the world how healthy you are. Good morning. Good morning, bonjour, bonjour, mesdames, messieurs, nos invités distingués. Soyez.
Dear guests.
I'm a Canadian, and I'm a citizen of the world like all of you. And more than that, like all of you, I am blessed. Blessed to have access not just to health care, but good health care. And all of you know it has made all the difference. Too many people don't, and that is why we are here today. Today in this exquisite hall, where time and again history has been made, you too will make history. Or should we say you will build on history? In the last 3 years, the first 16 members of the Global Financing Facility have made extraordinary leaps and bounds in healthcare, in investing in healthcare, investing in women and children and adolescents. Now you are 27, And as we heard from the mayor, soon you will be 50. And by 2030, with the promise to save 35 million lives. Ladies and gentlemen, the GFF is like one big capsule of vitamin C, or vitamin C as the British would say. C for catalyst, coherent, coordinated, collective, and most of all, country-led. Led by leaders who put the health, the well-being of their leaders first. We have a big day ahead of us. I have 4 housekeeping announcements. First of all, il y a des appareils pour la traduction.
First of all, you'll find interpreting devices on your chairs, on your tables for English and French.
And will be live streamed to the world. Please, don't fall asleep. Your mother will see you, your mother-in-law will see you. And even more, your president or your prime minister will see you, unless, of course, you are the president or the prime minister. And please, ladies and gentlemen, if you are expecting a call from your president or prime minister, please keep your mobile telephone on with a very loud ringtone, because we want to hear from your president or prime minister. But if you're not expecting a call from your leader, please turn your telephones to silent. There is no more important moment in your life today than today's GFF. And please, we encourage you to talk to the world. Hashtag today's Invest in Health. The Wi-Fi is Oslo 2017, all in lower caps. Let us begin, and we will begin with our 4 co-hosts. First of all, Her Excellency, the Prime Minister of Norway, Erna Solberg, who inspired us last night by reminding us that none of the SDGs will be possible unless there is SDG 3, investing in health and well-being for all. Also, Son Excellence, le Président du Burkina Faso.
His Excellency, the President of Burkina Faso, Rochmark Christian Kabore. Welcome.
And the ever so excellent CEO of the World Bank, Kristalina Georgieva, always the picture of good health, and the equally excellent Melinda Gates, the co-founder and co-chair, I'm going to say today, the Melinda and Bill Gates Foundation, which has made investment in health not just a priority, but a passion. Ladies and gentlemen, please welcome them to our stage. Monsieur le Président. Prime Minister Solberg, you have the honor of beginning our day, a day to inspire everyone who've come from far and wide to invest, to talk about investing in health.
Thank you, Liz, and it's a privilege to be hosting all of you here today. And thank you for making the time and the effort to come to Oslo to take the global financing facility to the next level. Let me start with a fact that never fails to bring home to me and my government the enormity of the challenges the world faces. Every year, more than 5 million women, children and adolescents die from preventable causes. They die from conditions or situations that we have the possibility and the ability to prevent or to treat. Conditions which in many countries aren't seen as life-threatening or life-limiting at all, like, for example, childbirth, the most natural thing that happens. For me, it is impossible to accept that the number of lives lost every single year is equivalent to the entire population of Norway. 5 million lives being wiped out every single year. And all because these people cannot access basic health services. This silent atrocity must stop. And the GFF is playing a vital role in this effort. Through innovative solutions like the GFF, we are tackling global health and relates SDGs head-on. And so, co-chair of the SDG Advocacy Group, I keep insisting that different SDGs are interlinked. Progress on one goal will create progress on other goals. And health is the best example. Improving health services will have direct impact on poverty reduction, on gender equality, on education, and on economic growth. And for that reason, the GFF is a priority for the Norwegian government and indeed the Norwegian people. And a core aspect for me is GFF's groundbreaking approach of maximizing the effects of health investments. It is an approach that is helping to ensure that every single human being has the chance to survive and the opportunity to thrive. We are strong believers in the GFF's potential. It's already working with 27 countries and more will follow. By expanding the GFF, more governments will build and strengthen the health systems that millions of people rely on for survival. We are also strong advocates of these guiding principles, principles that have country ownership and working in partnership at the core. I do believe that development only can come from the inside of a country. It cannot be put in from somebody else outside. So the focus on national ownership is key. Because for long-lasting change to take root and be sustainable, the countries themselves need to be in charge. To encourage this, we must change the way health services are viewed. We must stop seeing it as a large expenditure in our budgets and start seeing it as an investment in our people and thereby in our economies. We can create positive, sustainable cycles. Healthy populations lead to higher economic growth and prosperity. This in turn means that more can be invested in improving services such as health and education. And creating these cycles is how we reach the SDGs. A failure to invest today, on the one hand, can amplify problems for decades to come and undermine the potential of economic growth. So, ladies and gentlemen, the Global Financing Facility is an important innovative financing mechanism. It takes a cross-sectoral approach, addresses health, family planning and nutrition in a consolidated national plans. And it's tailor-made for sustainability because it involves countries, ministries of finance and domestic financing. Every country needs to invest in a sustainable future for their population. And the GFF encourages just that. A recent study showed that $2.6 billion from the GFF can mobilize between $50 and $75 billion from other sources, primarily domestic. This can contribute to saving as many as 35 million lives by 2030. So, together today, we are taking important steps towards saving these lives. So, let's make sure that we succeed during this day. So thank you all for your support, your efforts, and your commitments. And I look forward to the rest of the day. So thank you very much for being here.
Thank you very, very much, Prime Minister Solberg, emphasizing again that the development and investment must come from inside the countries, inside the partners, but also inside from its citizens, the well-being of its own citizens. Et maintenant, de la charmante ville
Now, straight from Ouagadougou to Oslo, Mr. President, the floor is yours.
Madame Erna Solberg, Premier Ministre.
Prime Minister, Mr. Erna Solberg, Mr. Prime Minister of Côte d'Ivoire, Ms. Kristalina Georgieva, CEO of the World Bank, Ms. Melinda Gates, co-chair of the Bill and Melinda Gates Foundation, honored guests, ladies and gentlemen, I would like to start by thanking Erna Solberg, Norway's Prime Minister. Thank you for welcoming us to Oslo, welcoming me and my delegation here. This is a great honor for my country, for Burkina Faso, as we are now co-organizers of this important meeting. I would also like to thank Ms. Kristalina Georgieva, CEO of the World Bank, for being here, as well as Melinda Gates, who is co-chair of the Bill and Melinda Gates Foundation. Your institutions have always helped us to find better solutions to development issues in our countries. I would also like to thank all participants for being here. This goes to show that you are particularly interested in mother and children's health. Honored guests, ladies and gentlemen, mother and children's health is really a big issue for socioeconomic development in countries like mine. That's why, even though our populations have other needs, well, Burkina Faso has placed this at the center of our priorities. This is really the biggest challenge we need to tackle. On 2nd April 2016, we launched a new program for free healthcare for children under 5 and for pregnant women. This means they can go to the doctor for free. If they are hospitalized, this is free, and medication is free as well. This means that we now have 3 visits to the doctor per year per child. This is the WHO recommendation, and 10 million visits have been allowed for children under 5. 700,000 women have now been giving birth for free. This is a very strong social measure, but we are also reinforcing our nutrition services. We have a number of actions to fight malnutrition, and we also guarantee food security for all children under 5. Of course, these measures have had positive effects, but we still have a number of challenges to tackle. Family planning now also needs to be free, and children's diseases need to be cured for free. We also need to do better preventive work on feminine types of cancer. That's why Burkina Faso has worked with technical and financial partners for working on an investment case. The horizon for it is 2023, and we can, thanks to that, optimize the impact of the GFF. This investment program represents $1.4 billion. The government will finance 49% of this investment case. The government and all actors on the national level are engaged for this plan to work. We, of course, have a number of issues. We have the Sahel region, fighting security problems, and climate change. Of course, we cannot reach our goals if the international community does not support our efforts. Burkina Faso joined the GFF in 2017 in November with 25 other countries, and we would like, during this conference, to thank the board of the GFF. Replenishment for the GFF. This is an opportunity for financial partners. They can now support member countries. And I would like to invite contributors and donors to show us their generosity, their solidarity, so that we can reach our goal of $2 billion. Of course, I would like to thank partners who have already made commitments, and I would like to show our renewed commitment at the appropriate level. Of course, we will have national resources available for improving mother and children's health. If we start with women and children, we can solve health problems for a large part of our populations. So I think we really should all engage for replenishment of these resources of the GFF today. Thank you very much.
Merci, Monsieur le Président. Merci beaucoup, Monsieur le Président.
Thank you. Thank you, Mr. President. Your presence here is highly important, and your commitment to the GFF is also very important.
Last night, Kristalina Georgieva said to me so proudly that one of the world's most important development finance institutions has now achieved gender parity at the top levels of the bank. And as we all know, you cannot achieve gender equality without health equality. Kristalina Georgieva, the stage is yours.
Thank you very much, and a very good morning to all. I'm very grateful to Norway, to you, Prime Minister Solberg, for bringing us here in this hall where the commitment to peace echoes so loudly. And what we do today is about making sure that we underpin development and peace. So why is it so important? It is so very important because by the end of today, in this one single day, 830 women will die at childbirth or because of pregnancy complications, completely avoidable. It is so very important because in our fight against extreme poverty, we will lose unless we address the underlying causes of conflict, climate change, governance, and yes, population growth. We know that in far too many places, the number of people living in extreme poverty is growing because of these reasons, including because women, adolescent girls, do not have access to health services, do not have access to contraceptives, do not have access to family planning. Our research shows that by 2050, Nigeria will have 50 million fewer people living in extreme poverty, and income per capita will jump by $2,400 if there is one child less per woman. And that is the picture in so many countries. And we are here today because investing in children from the moment they are conceived, born, and growing is the most important investment a country can make in its own people. That if we want countries to be wealthy, they do need this precious human capital, and we can do something about it. And yes, we are here today because we can do something about it. In the first 3 years of existence of the Global Financing Facility, $472 million have made a huge difference in 16 countries by creating conditions for reform of financing of health services in a way that prioritizes up what was prioritized down: women, children, adolescents. And we see the results. For example, in Cameroon, the number of family planning visits has doubled. in 14 provinces of DRC, just in 1 year, the assisted deliveries, in other words, women getting help at childbirth, have jumped by 14%, and children immunized by 25%. We at the World Bank are very firmly committed when something works to make it work more. And here in this discussion, I am very hopeful that we would be able to equip countries to have that capacity to make their investment case in the future of their countries. We can win the war against extreme poverty, and the GEF can play its small but so critical role in it. By the end of today, I am confident that we would go home and we would say, yes, it has been a good day in Oslo. Thank you.
Thank you, Kristalina Georgieva, for reminding us about war, the battle for healthcare for all in this hallowed place of peace. And she mentions just some of the examples, the real success stories of those countries who are part of the GFF. And if you haven't read them already in the development report of the GFF, I urge you to do so. They are truly, truly extraordinary how much can be achieved with just some extra investment and prioritization of healthcare inside countries. And now, ladies and gentlemen, to the last of our 4 co-hosts, Melinda Gates, who began this year by hailing a new era for women. And I checked out her bio, of course, on Twitter, as we always do these days, and she describes herself as a co-chair, as a businesswoman, and as a mother. And a mother, businesswoman, and co-chair dedicated to promoting healthy lives and well-being for all. You more than deserve to be here today. Melinda Gates.
Well, I'd like to start this morning by thanking my co-host. Prime Minister Solberg has been completely dedicated to women and children from the beginning, and so to have her host this event just seems so appropriate for us. Also for President Kabore for your leadership, not only in your own country, but also in the Sahel region and the example that you set of great leadership. I'd also like to thank Dr. Kristalina Georgieva. She has been the CEO now for a few years of the World Bank, and again, just her commitment to human capital, that is people's health and education around the world, is really something to behold in all kinds of halls around the world. And lastly, Miriam Clayson, who's here. You'll hear from her later today. I got to work with Miriam when she was at the foundation, and she's been a very strong leader for GFF. So it's my great pleasure to be here with all of you who are supporting the Global Financing Facility. When we think about life for citizens all over the world, it really begins with great health. If you have good health at the beginning of your life, it unlocks a virtuous cycle for the rest of your time. And what we're here to do today is to make sure that we finance places to have great health for moms and for babies. That's what today is all about. I was in Burkina Faso earlier this year and out in one of the health clinics, and I met with a young mom. I actually met with a group of young moms with their children. They all had infants or toddlers on their lap, and one that still reminds me today of what we're talking about here, her name was Minnie. And she was holding a very healthy toddler on her lap, and I got to talk to her about her young child. And we talked about all the things that were going well in her life, and then I said to her, well, and she was breastfeeding. She breastfed this baby and not breastfed her first child of 3, and this was her third. And so I asked her, I said, well, things seem to be going so well for you and this baby. Describe life to me before. And when she described the terror that she and her husband had felt 3 times in that first child's life where they thought they might lose that baby, when they talked about all the times they've been to the health clinic and how they'd use their family resources to save their first child, who had ended up growing up and doing fairly well. She talked about how she wouldn't have been able to have more kids if she hadn't learned to immediately and exclusively breastfeed. And she talked about how the stress in the family had gone down. And I think of that one example. That's what we're trying to do, is to start that virtuous cycle of health for all women and all children around the world. So if there's one thing I've learned in the last 20 years, it's that we have to have girls, women, and children at the forefront of the agenda. When you invest in them, they invest in everybody else in the family, and life improves, not only in their own family, but ultimately community by community and also in country by country. I also learned a really interesting statistic, given that we're standing in this beautiful hall that so represents peace to the world. I didn't realize that in situations where a peace agreement has been signed, it's 35% more durable if there are women involved in that peace agreement. So when you think about virtuous things around the world, that's the kind of world I'd like to live in. So I hope you see why our foundation is so enthusiastic about this event today. We're still very much at the beginning of this work, and it's exciting to see so many partners joined in it. When I look back at the beginning of Gavi and Global Fund, and I think about the investments that were made at the beginning and some of the mistakes we had to learn and how strong those two institutions have become, and the number of lives saved because of vaccines, or just to use one example from the Global Fund, malarial bed nets, it makes me all that much more excited about what we can also do with the Global Financing Facility for women and for children. So I'm confident in a few years' time we'll look back and we're going to remark on this historic day and the difference that it made for children and women all over the world. Thank you.
Thank you very much. It's a great phrase, the virtuous cycle of health. It really does all begin with health. Health of individuals and health of nations. Ladies and gentlemen, we're now going to have the first of what will be 4 panels today, of very distinguished panelists, all of whom have a great stake in the issues which have brought us together today. And our first panel is not just called Changing the Future, it is called Transforming the Future. Such is the power of investing in the health and well-being of women, children, adolescents, that is what can be achieved. And let me begin with you, Prime Minister Solberg, and of course to reiterate what has been said by all of our co-hosts about your leadership here. And Norway, of course, is taking leadership on the SDG 3 about promoting health and well-being. So how does your support for the Global Financing Facility, the GFF, fit into those ambitions? What place does it have?
Well, I think the GFF brings, as I said in my earlier remarks, the connection between domestic resource mobilization and support for health. And I believe that the long sustainability of health system is when you have a local investment in it. We started in Norway with supporting Gavi, the Global Fund. All of these are extremely important parts but we also need to make sure that the health systems of each country is sustainable for the future. And I think this was what was missing. So when we were invited by the World Bank before 2015 to be part of the launching of the GFF, we said yes because it was in line with what we thought was important. And we need we need to tackle these challenges differently. I think both Gavi and the Global Fund has helped us a lot on innovation, new ways of approaching, new technologies, but good governance does mean that you have to have investment in a country, and we put in money to support that investment. And that is what really will give the long sustainability of investment in health. So to us, this is part of what we would think is, I usually say, you should support policies in countries that you would use in your own country. And this is what I would use in my own country, saying we need to have local healthcare that functions.
And local healthcare decided by you for your particular country. So GFF certainly filled the gap. That's what we've been hearing from everyone. And Monsieur le Président, vous êtes à la tête d'une...
You are at the head of a country which is presently setting up a universal health coverage. How can GFF help develop your national priorities? And further, how can GFF support you or help you change the way you go about this? Thank you very much. I would like to start by saying that the main red thread of GFF aims at making sure that people in the different countries are actually mastering whatever is being set up, the health system, for instance. So the first prerequisite is that the government takes a major role, but also the private sector. But generally speaking, all these partners must take part in this major investment program because, as people have said before, health is to be considered as investment in development. That is the first step. Secondly, at national level, we need to secure the national resources in addition to what our partners will provide. And this is part of the overall investment which we will prepare. And this means a lot of responsibility and accountability on behalf of the various countries. And of course, we are investing in a specific sector, and there is an obligation of accountability. Quite obviously, we have committed ourselves to the citizens of our countries. We are making investments, and we need to work on this major capital because health and education are at the basis of the development of our countries. So this is a new approach which includes more accountability, which has this obligation of actually being aware and being accountable, and I believe this is going in the right direction. You mentioned there are several partners, the government, the private sector, the civil society, and obviously all these stakeholders need to work together.
Mantra, country-led, country-owned. As a development banker, what difference does it make in the investments and the success of the investments?
Well, just listening to President Caboret, it was so very clear that when there is a country that recognizes the importance of bringing everybody together around a common set of objectives and making sure that we all do our part. So the whole becomes bigger of this sum of individual parts. That this is what makes a difference. In my country, we have a very good saying, you can take a horse to water, cannot make the horse drink. All our analysis in development means nothing unless there is a genuine trust in the country that it serves the interests of its people. We have seen success indicators in development jump up dramatically when there is country-led programming. And we have seen reversals of development gains when there is lack of that ownership. And in the health sector, the Prime Minister was so very clear about it. To have systems that deliver means bring partners from private sector. By the way, in 10 of the 16 countries, we have seen dramatic increase of engagement of private sector, genuine engagement. When you have that way of bringing the different partners around the table, and your organizing principle is health systems that deliver, Country owns it, it happens. The country doesn't own it, well, the water is there, but the horse doesn't drink.
So country-led is one of the mantras, but the other one is, Melinda, you know, well, we all use it, you know, women and children first. People talk about that a lot. You know, even my own country now, Canada, has what's called a feminist foreign policy. And I remember I found myself asking, well, is it just a slogan, or what does, Melinda, you mentioned some examples in your opening remarks. What does it really make when you prioritize that in terms of the numbers, in terms of the results on the ground, putting women and children first? Well, oh, no, so to Melinda, sorry, to Melinda,
sorry.
yeah.
Melinda. Christina could just as well answer for me. She knows this work well.
She could answer for all of us, yes.
When you put women and girls first, it's interesting that you talk about the fact that we talk about this a lot now. But if you go back 20 years ago, when you would go in the halls of the United Nations, we weren't talking about women and girls' health. We had a Millennium Development Goal around those, but we weren't measuring, and we didn't even really know if we were making good progress on maternal mortality or child health. Today, we have a whole host of indicators. We actually collect the data, and what we're doing here is we're making sure we make investments on behalf of women and children, because when you make those investments, those children have a chance of growing up healthier. They also have a chance then of getting a great education in their country and living their full potential. And when I talk to moms around the world, and dads, but you talk to moms and you ask them, you know, what are their hopes and dreams? They don't talk about themselves. They talk about their children having a better life, their children getting a great education. But if their children are sick or they're not properly nourished, they can't go on to get that great education. And so that's why it's important that now women, girls, and children are finally on the agenda, but not just on the agenda. We actually have to resource for that so that we can make sure that there are fantastic little primary healthcare clinics about the size of this stage where women and children go for their services. So we need to talk about it, we need to collect the data, and we need to invest, and that's what we're doing.
And Prime Minister Solberg, there's only 12 years to go. It seems like a long time, but as we found out with the Millennium Development Goals, it isn't a long time. Now that we're meeting here today at this defining moment, what needs to change, and fast, if you're going to meet that SDG target by 2030?
Well, I think what GFF is doing is one of the things that we have to do to make sure that you have national planning for health. You have to have the measurements, as Melinda said, how the progress is. I have seen how, if you really follow what happens in the single clinics around in a country on why why do mothers die, why do children die during birth, that's the biggest point of learning in any health system. So make sure that you measure, that you have an investment locally, but also that we as donors support and make sure that we also have ways of dealing with, the innovation when it comes to health. It's important, to make sure that new knowledge is brought around to everybody. That is, I think, the knowledge sharing is one of the really important parts of this. I think we have a possibility of reaching this in health in most countries that are peaceful. I think the challenge we have now is in the areas where there is war, conflict, also in countries that now are in the GFF, of course, have areas where it's difficult to reach people because of the conflicts that they have. So we also have to work on conflict prevention, working on the security issues, because if we are going to take and leave no one behind really seriously, we also need to work on peace.
It's interesting, it'll be a bigger battle in the countries which are already besieged by battle, but as you've already seen that even in the Democratic Republic of Congo, which is dealing with an internal conflict, the progress that it's made by committing to the GFF. Monsieur le Président, quel message avez-vous?
Mr. President, what is your message for or towards other heads of state and government? Should they invest in health and education? Please give us a strong message. let me just say that there have been a lot of strong messages here so far. And speaking about health, let us remember that with GFF, it will be possible, as was said earlier, to plan health. And we're talking about a participatory approach. This is in our interest. Like the Prime Minister was saying, you can only change things from inside. And it's not a point of another country imposing a system or a mechanism. It's up to us, obviously. And we are to determine what we're going to do in terms of investment. And secondly, I also want to say that we finally need to realize that health is not a burden. On the contrary, it is an investment which in the long run, enables us to develop our economic growth and to make progress overall. And once this philosophy is accepted, it changed the paradigm on which we've been working because, you know, health is part of social issues, and it's considered as an expense, and that there is no benefit, no profit. And yet, all benefits can be found in maternal and child health. They are the basis of economic growth, of economic stability. And so we encourage all countries which are not involved. We all want to reach the SDGs within the deadline. But in order to make significant progress, we truly have to walk swiftly. We have to move swiftly if we want to achieve something. And I hope that all the other African countries which may not be included in GFF are included in the future.
With a clear and consistent commitment, but also the lines have to be clear. And Christina and Melinda, you both know, the infrastructure, the architecture is crowded. Christina Georgieva, the World Bank also has a human capital agenda, which is dear to you. How does that fit in with the GFF? So you're both pushing in the same direction.
I am the first to recognize that at the World Bank, for quite some time, we were somewhat neglecting investments in people, because we treated them more as social services, expenditures, rather than investments. This last year, we, for the first time, calculated the wealth of our planet, taking into account people, human capital. And it was actually quite shocking, even to us economists, that 2/3 of the wealth of this planet is us. So when we calculate physical capital, buildings, industries, natural capital, fisheries of Norway there as well, land, and then people, the richer a country is, the higher the share of human capital in its wealth. So those of you who are interested in numbers, the headline number is 1,123 trillion. This is how rich the world is. 2/3 is people. A poor country would have 40% or less of human capital in its wealth. A rich country would have 70% or more. And so the conclusion is so very obvious. You want to be wealthy tomorrow, invest in your people today. The Global Financing Facility addresses a particular issue in human capital, and it is women, children, adolescents. Very often deprioritized with all the negative consequences. And why it is deprioritized? Because, let's face it, we do still have problems with gender equality. We do, I mean, even in the wealthiest of countries, with the exception of Norway, we are, and women tend to not so much push for themselves. They do for their children, but not for themselves. So we are, with the Human Capital Project, we ranked all countries in terms of their human capital. Singapore came on top. Most of the countries that have high population growth numbers and low income per capita are at the bottom. So obviously we have to engage in investment case, and again the GFF brings a very useful platform to do so, to fix a problem of our own making. And we at the bank, you would see us very significantly moving our skills, capabilities, and financial resources to underpin the wealth of nations of tomorrow.
Thank you, very good. I feel as a moderator, I must say that it's fantastic for the World Bank to urge all of us women to be pushier. But with all due respect to the men here today, we do appreciate you as well. We do, we do. Melinda Gates, if this is going to work, all of the institutions and facilities and funds have to work together. Share with us, is there something more that the GFF has to do to fit in neatly and successfully with the rest of the architecture around health?
Sure. So I think one of the things we all need to be cognizant of is we wouldn't even be able to be here talking about the GFF, I think, if Gavi and Global Fund hadn't come first and hadn't been successful at what they're doing. So why are we seeing a reduction in childhood deaths around the world? It's because of vaccines, because of Gavi and what they've done, and also because of Global Fund, because of malarial bed nets. So when you see those two multilateral institutions getting better and better over time at procurement, at on-the-ground delivery, at reducing prices, we know these multilateral institutions can work. And so the way the GFF fits into that architecture is that when the UN gathered and looked at the progress made on the Millennium Development Goals, they said we've made good progress on some of these things, but we haven't made enough progress. We haven't made enough progress on maternal deaths. We haven't made enough progress on childhood mortality. And quite honestly, the hardest part of child mortality is still to come, which is 40% of the death are newborn deaths. We haven't made enough progress on family planning or nutrition. So the GFF fits into that global architecture because it's taking on the piece at the primary health care center that is about maternal and child health. When a mom goes to deliver a baby, if she starts hemorrhaging, which is one of the #1 causes of death of moms who are delivering babies, if there's a very inexpensive life-saving drug there, you're going to save her life. But if you don't have the supply there, she's likely going to die. And so if you have family planning supplies there, if you are welcoming to adolescence, which is something that Burkina Faso is working on, they're training their healthcare workers not to be biased against adolescents, you're going to do all the right things that help bring those sustainable development goals, those indicators down. So to me, I'm actually very excited about how these three are going to sit alongside one another and be complementary in what they do. And the GFF is going to learn from the lessons that Gavi and Global Fund have already learned coming before it.
Yes, very, very, very well put. Ladies and gentlemen, we've heard the rallying cries, we've heard the commitment, but there's no avoiding it. To use the American phrase, show me the money. Melinda Gates, you're a founding member of GFF. What is your commitment?
So our original commitment to GFF, because like all these institutions, Gavi and Global Fund that came first, we wanted to see if it worked. So Bill and I said, we initially in 2015 made a $75 million commitment to GFF, and now we've made a commitment to $200 million to GFF because we see it working.
Christina Georgieva, your money on the table?
In the pilot phase, the $472 million leveraged $3.4 billion of investments from the World Bank. Very significant increase in what we do in this area and very significant improvement of how we do it. With the day going forward, if we are to reach $1 billion, I pledge on behalf of my president and all our staff that we will provide a financial match of $7.5 billion. And
c'est bien, c'est très bien.
And I would make a second pledge. We are also using our going to markets to send a signal that this matters. We have issued so far 1 billion of, we call it gender bonds that send a signal, in Canadian dollars, by the way, I should say that. We pledge to use our going to markets to signal the importance of women and girls.
Merci, merci. I overheard the president of Burkina Faso saying, wow, unprecedented. Et Monsieur le Président, c'est à vous maintenant.
It's your turn. Well, I'd like to thank you. I have been very impressed by these announcements, by these pledges. May I say that it is the first for Burkina Faso to take part in the funding as well. And to start with, we will contribute for $1 million. We will contribute.
Very, 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 very important commitment for Burkina Faso to commit to the trust fund, to the GFF fund, as well as to the domestic resource mobilization as well. And lastly, to you, Prime Minister, to show the leadership that everyone has hailed here today in Oslo.
As I said, we have been a strong supporter of the GFF since it started. We thought that was a needed part of the architecture. And I agree with the fact that Gavi and the Global Fund has sort of showed the way for how we can invest in health. And you said on behalf of your president, well, I have to say behalf of my taxpayers, because they are the ones paying this.
Yes.
We will pledge for $360 million US dollars to the GFF.
Thank you very much. So thank you to all of our 4 co-chairs for your commitment in both financial as well as in moral and political and social terms. Thank you very much. Merci beaucoup, Monsieur le Président. Merci, Prime Minister Solberg. Thank you so much. Thank you, Melinda. So nice to see you again. Kristalina, thank you. Thank you. Ladies and gentlemen, let us all now, in the interest of health and well-being, take a deep breath and to reflect that good health needs not just pledges of money, pledges of commitment, it also needs good food. And to have good food, as you all know, you need a good chef. And on this day in Oslo, we've brought in for you a special kind of chef from the city of great cuisine, which is Geneva. And this chef for us today is the author of a cookbook. And the cookbook is described as recipes for peace, rights, and well-being. And he has decided that a vital ingredient in that is not just good health, but also the GFF. Please join me in welcoming the Director General of the United Nations Office in Geneva, Grand Chef Michael Moller.
Thank you, Lise. Well, this is off to a good start. Keep it up. Monsieur le Président, Madame
Chair.
Giver, Ms. Gates, Excellencies, ladies and gentlemen, it's a really distinct pleasure to join you today on behalf of the Deputy Secretary General of the United Nations, Ms. Amina Mohammed. The Deputy Secretary General was intimately involved in the development of the Every Woman, Every Child global strategy for women's, children's and adolescents' health, as well as a global financing facility in support of its implementation. And I bring with me her warm greetings for successful replenishment here in Oslo. Since its launch in 2015, the global financing facility in support of every woman, every child has proven to be an inventive and catalytic model for development financing. Guided by our vision of universal health coverage, we must double down on our commitment and target our resources for concrete results at country level. A full replenishment of the GFF stands to prevent some 34.7 million deaths and reduce maternal deaths by 32% and under 5 deaths by 35% by 2030. And this will go a very long way towards achieving the SDG targets and improve the lives of millions of women, children, and adolescents. Our investments in the GFF also stands to fuel pathways to universal health coverage, helping governments bridge national health spending more broadly and unlocking additional resources to strengthen the systems required to deliver health for all. And by ensuring access to reproductive, maternal, newborn, child and adolescent health and nutrition services, the GFF and its partners provide the foundation for the system required to deliver health for all. Primary health care will be a crucial piece of this equation. This year we mark the 40th anniversary of the Alma-Ata Declaration, and just a few weeks ago, Member States committed to a new vision for primary health care in the SDG era. So let us leverage this Astana Declaration on primary health care to go deeper in our efforts and ensure the full physical and mental health and well-being of every individual everywhere. Only through strengthened health systems and collective action across them will we achieve the results we envision. Continued alignment across the global health financing space will be critical to that. The GFF provides a unique model to help forge new ways of working that lays the path for complementary investments in health more generally. And I encourage the GFF to continue working closely with Gavi and the Global Fund to maximize synergies. The Global Action Plan for Healthy Living and Well-being for All presents an unprecedented opportunity for this necessary alignment and partnership that prioritizes investments in health. And next year's planned UN General Assembly high-level meeting on universal health coverage will be an important moment to generate the political commitment to deliver. Now, as ever, partnerships will be paramount. In a complex and evolving health and development landscape, collaboration and integrated delivery at the country level will be the linchpin to our success. We must ensure inclusive and country demand-driven planning and implementation, bringing all parties and sectors to the table so we can fully leverage respective functions and capacities. This concept is central to the GFF model, and it is a core of the United Nations Secretary General's UN Development Systems Reform, which were endorsed earlier this year and which is being put in place as we speak and will start being fully operational on the 1st of January. The UN stands ready to further support countries in the development and implementation of GFF investment cases through our technical assistance, our strengthened country team platforms, and our assistance frameworks. We welcome this replenishment and look forward to further collaboration on our collective journey to 2030. I thank you, and I wish you continued success for a fully replenished GFF. Thank you, Lise.
Thank you very, very much to Michael Moeller, who's the DG of the UN office in Geneva. And as he's underlined, partnerships are paramount. And now to the moment in this day, which I'm quite sure will live long in your memory, because it is, like everything else about today, about partnerships. And this too is a partnership between Burkina Faso and Norway. It is a partnership between tradition and modernity. The tradition of the Fulani nomadic tribes who go from west to east in the Sahel, and the modernity of what's described as the postmodern jazz traditions of Norway. Ladies and gentlemen, please welcome Bugge Wesseltoft and Adama Bare.
Aujourd'hui. Kala somme velkommen. Andu Burkina velkommen. President Faso velkommen. Andu famidara fofo mon domine wi don kam. E halu famiyette. Yimbe Faso nani yetta. Yimbe Norgendu yetti fofo mon. Alu faminane fofo mon. Fofo mon famiyetta non fofo. Yimbe Burkina Faso fofo mon. President Jodi. Yimbe me fa Norge fofo mon. Anna Solberg fofo mon. Halu fami yamane. Yettu yimbe men Burkin fofo mon. Halu fami yamane. E domine wi don kam. Halu gonga fami yette. E gollu lobbe fami halane. Merci beaucoup, Président. Sakirake sago Allah sago modo. Mama mi dara, mama kovida mi hala, mama sudu baba na yette, mama mi jamane, mama tuini alle ko yata, mama mi hala, mama yimbe Faso na yette, mama mi jamane, mama yimbe Norge na yette. Mama mi jala, mama pula kuyette, mama kovida mi hala, mama sudu baba na yette. So adili Allah wallo, ada warta du Allah wallo, kone yata hu Allah wallo, mama mi jala. Mama kovida mi hala, sudu baba ana yetta. Mama kovida mi hala, kananke mille mi yetti. Mama kovida mi hala, min silma beduna yetta. Mama mi yamane, yimbe men Faso yetti. Sudu baba ana yetta, yimbe mene Faso na yetta. Ada wadu kenga me yetta, ada gollano hande me yetta. Mama me jamane, yimbe mene kaji go yetti. Mangan jabbirgal mangan wakkata ko dasta ko suudu baba faɗɗitaake hayde koy mbayi kallogo ni kuudde ralla tante ko peŋadila me ɗo belay poore yungla mi ndiga mama ko wiɗami yette aɗa haali min ɗumi ƴamane aɗa muyanno mi yette aɗa dillanno ɗumi yette suudu babana yettede keŋa min ɗumi yette ala hokku makko kone haaja ala wallu mone fu e gollem Merci beaucoup.
Merci. C'est magnifique. C'était magnifique. Merci beaucoup. Merci beaucoup. Magnifique. Ladies and gentlemen, a reminder, if a reminder was needed, that promoting healthcare is not just about budgets and balancing the books, the bottom line. It is about people coming together for something which is much bigger than all of us. And coming together on a day like this, a historic occasion, une occasion historique pour réaliser.
So it's a historic moment to make progress.
Staff and equipment at our local clinic in Diene meant that we all survived postpartum hemorrhage.
Joy was born 7 weeks early. I couldn't believe she would make it. But thanks to staff trained in kangaroo care, she did. With my first child, I dreaded the measuring tape. Now I've had nutrition support. I feel proud when the midwife sees how much he's grown.
I wanted to grow my business and leave a longer space between my children. The monthly contraceptive jab means I have the power to choose this.
People feeling neglected out of the scheme of things. We're also creating an atmosphere of inclusiveness, giving them a sense of belonging.
Le mécanisme de financement mondial a vraiment apporté un énorme bénéfice. Dans la nouvelle approche, on met ensemble à la fois les fonds domestiques et les fonds des bailleurs. Il n'y a plus en fait un désalignement entre les acteurs.
We can show the whole country that we women have value, that we can say no to early marriage and yes to education to prevent poverty.
Ladies and gentlemen, a very powerful film about the power of health. Did you notice? No emaciated children, no flies, no anxious mothers, just smiles. Que de sourires. Qui parmi vous?
Who among you would dare to lead these people down?
Ladies and gentlemen, if you ask a journalist to be a moderator, you expect some breaking news. So I have some for you, fortunately. All the way from Kinshasa. Dr. Tedros, who you all know so well, who now heads the WHO, wanted so much to be here today, but couldn't make it for a very good reason. So he's asked, and I have the honor to read a short message from him. Excellencies, colleagues, ladies and gentlemen, mesdames, messieurs, please accept my apologies for not being with you in person. The GFF Replenishment meeting has been in my calendar for many months, and I was fully intending to come, but the ongoing Ebola outbreak, as you all know, in DRC demands my attention. As you are meeting, I am in Kinshasa with Jean-Pierre Lacroix, the Undersecretary General for Peacekeeping Operations, to assess how we can work together at the UN as one UN to improve security in the affected area and end the outbreak as soon as possible. Investing in the health and of women and children is vital for achieving a healthier, safer, fairer world. Let us clap loud enough so it's heard all the way to Kinshasa. Thank you. May I just say that I always say discipline is part of democracy, and we are not just exactly on time, but because we are in Norway, we are 30 seconds ahead of time. So well done, ladies and gentlemen. And let us begin to one of the most important part of our day together, and that is more of the pledging. We already heard the pledges from the Bill and Melinda Gates Foundation, from the World Bank, from the government of Norway, and also from the government of Burkina Faso. And now we will begin with the other generous contributors to the GFF Trust Fund and also to domestic resource mobilization. So it gives me great honor to first welcome to the stage Amadou Gon Coulibaly, qui est le Premier ministre de la Côte d'Ivoire.
Merci beaucoup. Excellences, Mesdames et Messieurs.
Excellencies, ladies and gentlemen, please allow me, on behalf of the President of Côte d'Ivoire, Mr. Salman Sarra, to bring you his regards to the co-organizers of this conference. And I name particularly the Prime Minister of Norway, His Excellency, the President of Burkina Faso, the Director General of the World Bank, and Mrs. Melinda Gates. Dear guests, I would like to say that Côte d'Ivoire, for the last 10 years, has been in crisis, but since 2012, we have made great improvements. We have improved the conditions of our population, particularly with respect to healthcare. And our efforts have been reflected in increased budgets increased by 15% for healthcare. So an increase of 15% for healthcare per year. since 2012. And we really stress the importance of access to healthcare for people who need it. And the proportion of the population in Côte d'Ivoire that used to live further than 5 kilometers away from a health center went down from 56% in 2012 to 33% in 2015. In other words, before, more than half the population had to go more than 5 kilometers to find a health center, and now it's only a third of the population. And also the frequency at which people go to health centers, it went from 32% to 42% in 2015. So, and then the ratio of women that now get help by midwives went from 1,731 to 992. But of course, we still have problems to face. We have problems to make sure that the health services are of a good quality. We still have mortality of women, 614 for deaths for 100,000 births, and life expectancy is only 53 years, but malnutrition is down to 6% for children below the age of 2. So we're coming close to the target of 5% set by the WHO. So in spite of all these problems, our government is adamant that it will strengthen its spending on healthcare, and we make pledges to reduce out-of-pocket expenses in order to reduce the costs of healthcare, and we will implement universal healthcare from 2019 on, and we will start with the poorest and the most vulnerable people who will benefit from this UCH. We will also improve the quality and greater access to healthcare, and for that we have launched an investment program that will cost roughly 232 billion CFA francs. So that will lead to the construction and equipping of health buildings at all levels. So we will have the primary care units, we will have general hospitals, we'll have regional hospitals, we'll have regional major hospitals, we'll have university hospitals, and we'll have specialized units. And we also have a multi-sectoral nutrition plan. That plan has started in 2016 and will run till 2020, and it costs 266 CFA billion, and that is 436 million euros roughly. Now, we still have major problems, and that is why Côte d'Ivoire is very happy that there was a GFF initiative in November 2017, and we see that the involvement of the GFF will make it possible for us to have the proper investments. We will increase our domestic resources, and we will mobilize more donors. And I want to reaffirm the commitment of Côte d'Ivoire to use domestic resources at least 15% per year, and this will be spent on healthcare, and it will be also used for advancing its social program. So, ladies and gentlemen, let me end by expressing the hope that with action we will bring together donors and different governments, and that we will make progress, that we will be able to face up to our problems, and that worldwide we will give to every woman, to every child, and to every adolescent the same chances of survival at birth, and to guarantee them good health all through their lives. And for this, on behalf of the President of Côte d'Ivoire, Côte d'Ivoire undertakes and commits to contribute to GFF of $1.5 million.
Merci beaucoup, monsieur.
Thank you, Prime Minister. Thank you very much for the commitments you have made today.
Man, I think he's got a lot of fans, given the applause we heard during the film. The Minister of Health from Nigeria, Isaac Adewale, the giant of Africa, standing taller even today. And what a great bow tie as well.
Your Excellencies, Mr. President, Burkina Faso, Madam Prime Minister, Norway, Mr. Prime Minister, Côte d'Ivoire, Chief Executive Officer, World Bank, Co-Chair, Bill and Melinda Gates Foundation, fellow ministers, distinguished ladies and gentlemen. In 4,439 days from now, global players, we gather to assess the success of the SDGs. Countries, partners, civil society organizations, and all relevant partners working to improve health outcomes will look towards SDG 3, particularly SDG 3.8, to determine how well we have fared. Evidence suggests that we are not on track to achieving UHC by 2030, with resource mobilization for health remaining a challenge for many countries. Yet, we can do better and should do better. In Nigeria, in recognition of the linkage between health and economic growth, we have committed to increasing access to all with funding of the Basic Healthcare Provision Fund. We have the opportunity to expand access of high-impact interventions to underserved communities. In 2018, we increased our fiscal space for health by an additional $150 million to provide an explicit but guaranteed set of services to the underserved. We have also committed the same in 2019. We have also committed an additional $1.9 billion over the next 10 years as part of our commitment to financing immunization for our children. This has helped to unlock $1.03 billion from Gavi over the same period to strengthen our immunization program and ensure every child is fully immunized. In addition, we're engaging subnational governments to prioritize health. This effort is showing promise. Under the World Bank-supported nutrition project, states have committed their own resources towards reducing the burden of malnutrition. To make this sustainable, we are actively engaging our partners and colleagues in the Federal Ministry of Budget and National Planning, as well as Ministry of Finance, by demonstrating value for money of existing resources, and secondly, by ensuring that program objectives clearly indicate that these are consistent with the interests of the people of Nigeria. Today, I, on behalf of Nigeria, pledge to sustain our efforts on increasing domestic resource use and mobilization for the attainment of universal health coverage. Thank you.
Thank you. And thank you to Nigeria and now to Canada, which is another one of the founding members of GFF. Please welcome Diane Jacovella, who's the Deputy Minister for International Development for Global Affairs. Merci beaucoup.
Bonjour tout le monde.
Good morning to all of you. It's a great privilege and a pleasure to be here on this historic day.
Partner of the Global Financing Facility. In fact, I myself had the privilege of being involved in the negotiations that led to the creation of the GFF in 2015. And at that time, we had a vision of what this financing facility could become. And let me tell you, we are so pleased that this vision is being realized. I'd like to briefly outline a few reasons why Canada thinks the world needs more of the GFF. First, the GFF can play a powerful role in reducing gender inequalities. Engaging women, youth, and marginalized populations as part of an inclusive country-led process help countries prioritize underfunded but high-impact areas of health, such as sexual and reproductive health and rights, that are so crucial to address inequalities. Second, the GFF provides a platform that can support an integrated human capital agenda. By breaking down silos between health, education, and nutrition, and improving the integrated delivery of services, the GFF is well placed to support countries to do what makes sense in their particular context to invest in their most vulnerable population. Finally, the GFF is an excellent example of innovation in action. By building in the financial incentive of the pop-up linked to IDA and IBRD loans and crowding in private sector funding in innovative ways, it has proven effective at mobilizing more resources for health and nutrition. For these reasons, Canada continues to support the GFF and promote its expansion to all eligible and interested countries around the world. I'm pleased to announce today Canada's pledge of an additional 50 million Canadian dollars specifically for 2019. This funding is part of Canada's G7 commitment to addressing barriers to education faced by women and girls in fragile and conflict-affected states. It is well known that poor health can be a barrier to girls' access to education, and a supportive education system can help address challenges related to health and nutrition. This pledge is intended to complement our ongoing funding and also to provide specific support to the GFF to help improve the integrated delivery of health and education services for girls facing conflict, crisis, and fragility. With this announcement, Canada has increased its total commitment to the GFF to 290 million Canadian dollars for the period 2015 to 2020, and Canada remains committed to supporting the GFF, including through this second replenishment period up to 2023. The GFF has achieved so much in such a short time frame. Canada is so proud to be part of this initiative. In closing, I would like to thank our co-hosts for convening this event, and I would also like to thank the 27 GFF countries for making a real difference in the lives of women, children, and adolescents. Thank you very much.
Merci, Diane. Merci, merci. From a founding member of the GFF to a new member of the club, let us welcome the European Commissioner and its Commissioner, Neven Mimica.
So, very good morning, Honorable President Kabore, Madam Prime Minister Zolberg, Mr. Prime Minister Coulibaly-Gon, Ministers, Excellencies, dear Kristalina, Melinda, dear colleagues and friends. Let me thank our co-hosts, the governments of Norway and Burkina Faso, the World Bank, and the Bill and Melinda Gates Foundation for your vision and leadership on how to deliver on the health objectives of the Sustainable Development Goals agenda and on organizing today's event. The Global Financing Facility has a simple and singular mission: to protect and support every woman, adolescent, and child by improving their health access and outcomes. This is about unlocking their vast potential, and this is central to our global promise to leave no one behind. It is central to our renewed European development framework to promote human dignity, prosperity, and well-being. And it is central to my personal commitment to champion those who need us the most. Investing in better health care, education, and nutrition is our greatest gift to the next generations. In a rapidly changing world, and for an increasingly young population in Africa in particular, we need even more ambition and innovation. Therefore, the European Union pledges to deploy at least 20% of its total development financing capacity for human capital development projects across the globe. We are fully committed to using all means possible to help achieve our global goal on healthy lives for all. To achieve this goal, we need strong partnerships at every level, with governments, civil society, the private sector, and international and national financial, health, and development institutions. At the European level, we are stepping up our joint efforts with our member states. At the global and country level, we are already working with many partners present here today through partnerships like the Universal Health Coverage Partnership with the WHO, initiatives like the Global Fund and Gavi, and through our many bilateral cooperation with many partner countries. What we need now is decisively working on making better balance and better complementarity between our global health initiatives engagement and our country-level health systems. Innovative global partnerships like GFF have the synergy and potential to leverage resources, increase attention, and ensure that global health initiatives integrate better at country level, as well as coordinate better among themselves. We are determined to work together along these guiding principles in delivering global and individual health objectives. At this point, I reiterate my confidence that the GFF can take an important role in our common efforts to deliver on the health targets of SDG 3 by 2030. This is why I want the European Commission to take part in the GFF, including in its Trust Fund Committee, and contribute to delivering its full potential. For this reason, I am pleased to announce $30 million of support for the GFF. Thank you very much.
Merci beaucoup. Merci, thank you. Welcome to the Club for the European Commission, and welcome back to a long-time partner of the GFF, to the United Kingdom, and to Darren Welsh, who is the Director of Policy at Britain's aid agency, DFID. Darren Welsh, thank you.
Thank you very much. Good morning, everyone. Excellencies and partners, it's a great privilege to be here with you today, representing the United Kingdom Secretary of State for International Development, Penny Mordaunt. Secretary of State wanted to be here herself, but unfortunately, unavoidable parliamentary business is keeping her in London today. But she has asked me to convey her very strong support for the work of the GFF and her thanks to our esteemed co-hosts for arranging and hosting this event. We highly value your commitment and leadership to this important issue and to the partnership we have together in the work of the GFF. As you all know, the UK has been involved in the GFF from the very beginning, and we have closely followed its progress. We first became an investor last year, committing 30 million up to 2020. And we did that because we have confidence in the work you do to improve the health and well-being of women, babies, children, and adolescents. This work is central to achieving SDG 3 and foundational to achieving the other SDGs, as Prime Minister Solberg reminded us earlier, and especially gender equality. The UK's support for the GFF also aligns with our strong focus on women and girls and our determination to leave no one behind. Overall, the UK is the second largest donor globally to women and children's health, supporting a wide range of investments through our bilateral programs, our multilateral partnerships such as this, and our policy engagement. And we also tackle some of the more difficult issues, including safe abortion and ending female genital mutilation. Now, as a global community, we've come a long way, and we heard about some of that progress earlier. But we believe a radical new approach is needed to reach those women and girls, babies and children who are still left behind. And we believe that the GFF has a big and catalytic role to play in that process. We need to support countries to finance more of their own healthcare and bring in the private sector. We need more coherent collaboration between all actors, including a focus on long-term strengthening of health systems, not just short-term measures. And we urgently need to improve the quality as well as the quantity of care, making sure we reach those who are most hidden and marginalised, including people living with disabilities. And at a time when the majority of maternal deaths occur in fragile settings, we need to get better at operating in those most challenging environments. As we've heard, the GFF is already changing countless lives for better, and we celebrate that, but we want it to achieve even more. As it moves to its next stage with this replenishment, we want the GFF to become even more transformational. If we get this right, the GFF has the potential to deliver even more outstanding results. For example, contributing to the saving of 35 million lives by 2030 and the prevention of 275 million cases of stunting. So the UK team has been talking to the GFF partners about how, in particular, we can ensure that these investments work better in alignment with everything else that's happening in country as part of a more coherent, coordinated package for women and girls. And we're really excited by the opportunity that's coming out of these discussions, and we're grateful to colleagues for the collaborative and positive way in which they're responding to our ideas. So on that basis, I'm delighted to confirm on behalf of the Secretary of State today that the UK will commit to providing a further £50 million from 2020 to the GFF. Thank you again. So thank you again for inviting me to speak on behalf of the Secretary of State. You can be assured of the UK's very strong support as we work together to achieve the challenging goals we set ourselves. Thank you.
Thank you. Thank you to Britain for staying with the GFF, and thank you to Germany for joining. The stage now for Hans-Peter Bauer from the German Ministry for Economic Cooperation and Development.
Excellencies, ladies and gentlemen, I'm really glad to be here in Oslo, and thank you very much for the wonderful event and the invitation. Over the past 20 years, we as a global health community have improved and in fact saved the lives of many millions of women, children and young people through our combined efforts. And now it is time to expand this progress in health and nutrition to include all women, children and adolescents. We believe that achieving lasting success will depend crucially on the leadership of the most affected countries themselves. The Global Financing Facility is working with partner countries to accelerate action for the health of women, children and adolescents, and to boost domestic resources, that's of utmost importance, to sustain the gains being made. We believe that this is the right strategy, and that is why we are pledging a total of 50 million euros for the work of the GFF, subject to parliamentary approval and budgetary availability. As we make this our first commitment, we would like to stress that we greatly appreciated that the GFF recently made a commitment for its part. And we assume that our Norwegian hosts feel the same way. As a signatory to the SDG 3 Global Action Plan, the GFF has committed to fully align its efforts with those of other relevant actors in global health. We encourage the GFF to continue on this path and to redouble its efforts to strengthen coordination, improve communication and reduce fragmentation at the global level and also in the countries it supports. However, to us, the most important commitments remain those we have made collectively as part of the Sustainable Development Goals to every woman, every child and every adolescent. This includes areas in which progress is weak for the time being, such as rights-based family planning, we have heard about that, nutrition and adolescents' health. So we look forward to working with the GFF and with you all, and all of you who share the vision coming through in all the commitments being made. Thank you very much.
Thank you to Germany, to Hans-Peter Bauer, a new member of the GFF Club. And please welcome Alan Wassalan, a new member of the club from the Middle East, from Qatar. Sultan bin Saad Al Maraiki, who is the State Minister for Foreign Affairs from Qatar.
Thank you, Your Excellency, distinguished guests, ladies and gentlemen. I would like to thank the government of Norway for hosting today the replenishment event of a global finance facility in partnership with the government of Burkina Faso, the Bill and Melinda Gates Foundation, and the World Bank Group. The State of Qatar values the importance of this global initiative that aims improving the health and nutrition of women, children, and adolescents across the developing country, in line with the Sustainable Development of Goal number 3. Under the leadership of His Highness the Emir Sheikh Tamim bin Hamad Al Thani, the State of Qatar is investing in health program to improve reproductive, maternal, newborn, and adolescents' health across the developing country as a part of its foreign aid strategy that aims supporting human development and achieving the 2030 United Nations Vision Sustainable Development Goals. In order to address a large funding gap in the health sector, it is important to establish goal partnership and adopt a new financing approach that combine domestic financing, external support, and innovative sources for resources mobilization and delivery in a synergistic manner. The Global Finance Facility, GFF, represents a unique platform to address the global health challenges and secure additional funding for health and nutrition by blending grant with the World Bank's IDA and IBRD financing. Through its partnership with the GFF, the Qatar Fund for the Development aims at contributing effectively to the global strategy for women, children, and adolescents' health. Today, I am proud to announce the pledge of the State of Qatar to the GFF Trust Fund of $30 million over the period of 5 years, starting from 2019 until 2023. We hope this contribution will support country-led programs and strengthen national health system to ensure better maternal, children, and adolescent health across the developing country. Thank you for listening. Thank you.
Another $30 million from a new member from Qatar, Sultan bin Saad Al Maraiki. Thank you very much for coming here. So many new members, everybody wants to join. And now the Netherlands, for the Director General of Development Cooperation from the Ministry of Foreign Affairs, René Boerice.
Good morning, Excellencies, distinguished guests, ladies and gentlemen. The Netherlands will join beating the drum. We pledge to invest in the GFF €58.5 million for 5 years until the end of 2023. And our decision is based on 3 pillars. More and new funds are required to achieve the SDGs, and to ensure basic health and nutrition needs and rights, including sexual and reproductive health and rights of women and girls. GFF is working on financing the investment case for health by mobilizing domestic funds and through innovative financing. We see this as the opportunity for governments to invest more in freedom of choice. Secondly, GFF is about a country-led agenda with increased cooperation between different stakeholders, national and international public and private health and nutrition actors, including civil society. This multi-actor approach represents our collective responsibility in achieving the SDGs, and particularly SDG 3+, providing a voice to the population to express their needs and desires is an important role of civil society. These voices need to be heard. Only then we can achieve truly sustainable change and the needed transformation. Third, the focus on sexual and reproductive health and rights for young people, freedom of choice, especially for young women and men. They can only unlock their full potential when they are empowered to decide and when they have access to information and services that respond to their needs. Young people from Mozambique, Burkina Faso, Uganda, and Mali and Ethiopia made a short video message about their needs. To quote one of them, Eugenio de Sousa, 22 years old from Mozambique, make sure young people are aware of the services that are already there, but also actively involve us, especially in sexual and reproductive health services. Ladies and gentlemen, protecting and providing freedom of choice regarding sexuality and reproductive rights is an opportunity and need that will be supported by GFF, leading to empowerment and economic gains on both the individual and national level. Thank you very much.
Thank you very much. Thank you, Dana. Thank you. 58.5 million euros coming from a new joiner to the GFF from the Netherlands. Today, ladies and gentlemen, is not just about governments pledging, it's also about the private sector. And now to the Lardale Global Health, a non-profit which helps to save the lives of women and newborn. Its executive director, Torre Lardal.
Your Excellencies, ladies and gentlemen, mothers and newborns of the future, good morning. Lardal Global Health is a private sector, not-for-profit arm of Lardal Medical, fully focused on helping save lives at birth in low-resource settings. Since 2010, we and our partners in the Survive and Thrive Alliance have helped train and equip over 500,000 birth attendants in more than 80 low-resource countries. In the Helping Babies Survive and Helping Mothers Survive educational programs. Large-scale studies in more than 6 countries show that these programs can reduce early maternal and newborn mortality by as much as 50% when well implemented. Today, we are delighted to announce a commitment of $12.5 million to a new partnership between the Global Financing Facility and Lardal to support scale-up of innovations that can improve the efficiency and quality of healthcare at birth. GFF will match this contribution of $12.5 million and host the partnership as a new Innovation for Scale initiative. GNF and Lardal will shortly announce a call for proposals for implementation partners who within 3 years can bring innovations to scale in collaboration with governments. Our goal is to establish a strong case examples that can guide the way and inspire many more country-level investment cases that can leverage private sector innovations. GFF and Lærdal will also reach out to potential further private partners, including foundations, and invite them to join this initiative by contributing additional funding and/or collaborative commitments that could further increase its impact. Thank you.
$12.5 million from Lærdal Global Health. Thank you very much. Now more Nordic commitment from Denmark. Martin Billa Herman, who's the State Secretary for Development Policy at the Ministry of Foreign Affairs. Welcome.
Thank you for the introduction, Liz. Let me begin by thanking our co-host. It's good to be back in Oslo for a day. This is practically our second home, as many of you will know. Excellencies, ladies and gentlemen, colleagues and friends, I'm delighted to stand before you on behalf of the Kingdom of Denmark to pledge not only our political and financial commitment, but also our wholehearted dedication to the advancement of the health and rights of women and girls globally. Denmark's a long-standing, and as many of you will know, often outspoken advocate for the rights of women and girls, including sexual and reproductive health and rights, because these are not only fundamental human rights, they are also absolutely imperative to increase prosperity around the world. Women and girls must be able to decide over their own bodies, their own health, and their own lives, because only that way can they fully contribute to their own lives, their families, and their societies. But to advance this cause, we must work in partnerships. Partnerships with countries, multilateral organizations, the private sector, foundations, civil society, and academia, men and women, boys and girls, young and those of us that are no longer so young. Now, this is why Denmark joined the GFF last year, because it promotes partnership. And this is why I'm pleased to announce today that the Danish government has proposed to Parliament to make a new contribution in 2019 of 75 million Danish kroner, or 10 million euro, to the GFF Trust Fund. We look forward to continue our close cooperation with all partners present here today to right the wrongs which have endured for too long. And I want to end by quoting a good friend who once said, "Allow a woman to spread her wings and the whole world will fly." Thank you.
Thank you so much to Denmark. Now to Japan. To Takahashi Miyahara, who's the Deputy Director General of the International Bureau of the Ministry of Finance from Tokyo. Welcome.
Thank you. Thank you very much for your kind introduction. And Excellencies, distinguished guests, ladies and gentlemen, this is my honor and great pleasure to be here to share with you that Japan has become a partner of the GFF community as late as December last year, when the Japanese government hosted a U8C Forum 2017 in Tokyo, when our Deputy Prime Minister and Finance Minister Aso made a pledge, the first pledge of Japan to the GFF, amounting to 30 million US dollars for the next 3 years. And there are two reasons why the Japanese government has decided to partner with the GFF. The one, it's the GFF's convening power to connect all the various donors and the providers of the assistance in the field of the maternal and child care. even in the very short period of time since its establishment in 2015. So while Japan has also been placing the focus on the cooperation assistance in the field of maternal and child care, healthcare. Since our early years of development assistance. So we count very much on the GFF's ability and power to convene the donors and service providers further in order to empower our collective international assistance for this field. And then second, we are very much impressed by the leveraging power of the GFF. And needless to say, maybe the people here should know, everyone should know that not only the sovereign funds can meet the huge demand for the for assistance in the health fields, including maternal and child care, and then where the GFF has already shown a great track record in catalyzing the various sources of funds, including the domestic resources, the bilateral donor funds, and multilateral assistance, the financing, and so on. So this the leveraging power and ability of the GFF should be even more important in the coming years, and that's why the Japanese government has decided to put our money in the GFF. So. The finance minister also made two kinds of pledge the last December. The one is the $30 million for the next 3 years, and then now the first installment of the contribution has already been delivered, and the rest of the 30 million will be delivered this year and next year. I'm sorry, the next year and then the year after next. And then another pledge was that the additional $20 million in the respective periods. After confirming that the GFF has demonstrated and expected an increasing the power of leveraging, for instance, with respect to the resource of the IDA, the 18th and perhaps 19th period. I hope. We have already confirmed that the GFF has shown the very strong the ability to mobilize the external funds, and so assuming that this trend continues, then I hope, I believe that the Japan can deliver on the additional $20 million very soon. Thank you very much.
Takahashi Mirahaya underlining Japan's commitment last year of $30 million. And if the World Bank keeps its word and does what it's promised to do, there could be another $20 million in the pipeline. Ladies and gentlemen, we should thank collectively all of the partners who took to the stage this morning. But the pledging is not over. Those of you in the room who may be considering pledging, or those who are watching on the live stream, it's never too late, and indeed never too early, to contribute funds to the GFF. Now I must hand the stage to a woman I have to say has never stopped smiling all morning, Miriam Clausen, who's the director of the Global Financing Facility.
Thank you. This is a very nice task. So, honorable ministers, your excellencies, Prime Minister Solberg, President Kabore, dear Melinda, dear Kristalina, thank you so much. Thank you so much for being here together with our honorable guests. On behalf of the GFF Secretariat, I would like to really thank you. But the pledging isn't over. It's my honor to be able to share with you on behalf of a donor who wishes to remain anonymous an additional commitment. So please give a round of applause to an additional $75 million that has been committed to the GFF Trust Fund. Just 3 years ago, the GFF was launched in Addis Ababa. It has now, in these 3 years, supported 27 countries that you've heard of in their efforts to end preventable deaths of mothers, newborn, and children, and improve the health and well-being of women, children, and adolescents, including in fragile areas and including reaching those who are hard to reach. It has helped to prioritize and align existing funding, but has also, through modest grants through the GFF Trust Fund, mobilized additional financing that is needed to expand coverage of life-saving interventions. Your generous commitments made here today in Oslo will enable us in the GFF partnership to expand support towards the 50 countries with the highest maternal, newborn, child, and adolescent health burden. Today, the Oslo Replenishment event is really, for us, the key milestone on this path towards expansion to 50 countries. As we have heard from His Excellency President Kabore today, this support is making a difference, but so is the commitment to drive sustainable change for countries. Countries are not only facing huge demand and need, as we have heard, but so is the commitment towards addressing these problems. What will make us succeed together with your important financial commitments made here today, is indeed that countries are truly committed to take the lead. And this includes committing their own domestic resources and committing to reach those that are furthest left behind first. The ambition we have to end preventable deaths of mothers, newborn, and children and improve the well-being and health of women, children, and adolescents by 2030 is too large for any one organization or country to manage alone. So our partnership together with countries is therefore essential, together with governments, civil society, and all key stakeholders at the country level. That's what's driving results. We from the GFF can support this partnership. We can help ensure that it drives results. And we can help mobilize additional financing needing to really have an impact at the scale needed and sustainable impact. But without countries' own commitments and the support that we have seen here today by all stakeholders, countries cannot achieve their sustainable goals. So this is truly a partnership, and we have the honor today to continue this discussion, and I will have the honor soon to hand over the words to our Honourable Minister Astor, but I do want to make 2 points before concluding. First of all, of course, to again thank all of you here and those who are following us over live stream for your invaluable support over the past years to get us where we are today. We are a small secretariat. We are a small secretariat of just 26 staff. And we would not be here today without each and every one of you. Our partnership is what makes us succeed and what drives results at the country level where it matters. That's where it matters. Secondly, I would like to remind all of us of the urgency of this task at hand. When a young adolescent girl, still a child, faces a future of maybe 7 kids, several before she is fully grown, we don't have time to waste or lose. When a pregnant woman lacks access and cannot afford the health care when she needs it urgently, or lacks the education, the enabling environment, and the empowerment to actually make the right decision for herself and her child, we don't have time to lose. When kids still move through their early years stunted, we don't have time to lose. When a government and civil society in the country cannot access funds, or do not even know the funds that are flowing because they are not on budget, then we need fundamental change. So we are very, very honored to take our mission forward with your support today. So thank you so much.
Thank you to Miriam Claassen, who's the director of the GFF. And finally, we need a little bit more Norwegian practicality, pragmatism, and the numbers. The Minister of International Development, Nikolai Astrup, please.
Thank you so much. I am acutely aware that the only thing standing between you and lunch is me. So I'll try to be short. Ladies and gentlemen, excellencies, the GFF is our tool for securing health and nutrition services for every woman, every adolescent, and every child. All of you have helped to ensure that this is the case. I would like to thank you, Mariam, for your able leadership of the GFF Secretariat. And I would like to thank the whole GFF team and those who are members of the partnership. Without you, there would be no GFF. I would also like to thank everyone here today, and especially the countries that have made commitments, and the donors that have pledged continued support for the GFF. Let me give a special welcome to new donors to the GFF. Today, we have raised more than $1 billion. More than $1 billion to help governments transform how they set priorities. More than $1 billion to finance health and nutrition services for women, children, and adolescents. More than $1 billion to finance development and to achieve Sustainable Development Goal number 3. Healthy lives and well-being for all, at all ages. The additional funding we have raised today makes this a truly momentous occasion, and I'm quite proud that this event is being held in Oslo. The co-host of this GFF replenishment deserves special thanks. President Kaboré of Burkina Faso has shown today that it is possible for countries to change the way they think about health. It is possible not to see the money spent on health as an expenditure, but as a crucial investment in the future of the country. An investment that will pay off for the country's women, for its adolescents, for its children, for its people. Burkina Faso's contribution to the GFF Trust Fund shows the country's commitment to this approach, and is a testament to the GFF as a truly country-led model of development finance. Melinda Gates and the Gates Foundation, you have invested and reinvested in the GFF. And I believe Melinda said, when you first invested in the GFF, that you wanted to test out the model, and then reinvested because you saw the results that had been achieved. And thank you for your leadership, generous commitment, and support. Kristalina, CEO of the World Bank and host of the GFF Secretariat and Trust Fund, has shown how committed the World Bank is to increasing investments in human capital. By linking large amounts of World Bank IDA concessional financing with GFF Trust Fund grant money, the World Bank is advancing this agenda and helping countries scale up their investments in health and nutrition. And Erna Solberg, Prime Minister of Norway, has reaffirmed my own country's great belief in and commitment to GFF. Today she announced $360 million to take the GFF into its next period of expansion. We are fully committed to moving the GFF forward, and extending its reach to a total of 50 countries that need and have expressed interest in its support. We're also delighted today to see pledges from the European Commission and the governments of Canada, Denmark, Japan, Germany, the Netherlands, Qatar, and the UK. Burkina Faso has shown great commitment to improving the health and nutrition of its people, and we are delighted to see commitments from Côte d'Ivoire and Nigeria. Thanks also to Lardal Global Health for its commitment of $12.5 million, and to our anonymous donor for a generous commitment of $75 million. As Prime Minister Solberg said, it takes close international cooperation to solve the challenges the world is facing. The more we work together, the more we can achieve together. And the commitments made today are proof of this. Most importantly, the impressive collaboration we have seen today will improve the lives of millions of women, children, and adolescents across the world and help transform the way we finance health and development in the time ahead. We know there is still a great deal of work to be done, but please join me in a round of applause for all those who today have made a commitment to taking development financing and investments in health and human capital a large step forward. Thank you.
Ladies and gentlemen, you have this morning worked so quickly, so kindly, that you have earned yourself an extra 15 minutes for lunch. And you have earned your lunch, more than $1 billion pledged. We will return again to this hallowed hall at 12:45. This afternoon will bring us 3 excellent panels and another short but very powerful film. But for now, in this exquisite building where next month the Nobel Peace Laureates of this year will be honored, come on, feel like a Nobel laureate today. Go where you've never gone before, up this staircase and all around to have lunch in the banqueting hall. It is that moment to break bread as partners and as friends. But please, don't eat too much. You'll fall asleep, and there's a live feed. And your mother, every mother is watching. Thank you very much.
Test. c'est Norway à gauche. C'est la quatrième. Ici. Ici, c'est Berlin.
All right, and this thing, it doesn't require any special password. Door ferdig. What the hell is that?
I can speak Norwegian.
You don't?
That's terrible. It's one of my many failings.
James, you'll never survive here.
I know, sometimes you can get a bit of it. I speak Dutch, so you can...
Oh, you do?
But yeah, so this will come up. There might be some Germans as well.
All right, and we're supposed to start at 12?
We're not supposed to start at 12. We're 2 minutes away.
Yeah, but I don't see any... I think so. It will come up. It'll just show, will it?
It'll just come up as if you go normal.
Okay. I don't need to. It's already on.
Thank you very much for those of you who are on the line. We're just about to start. We'll be starting in a few minutes. Thank you.
There's yes.
Welcome to the GFF press conference. My name is Tim Evans. I'm the Senior Director of Health, Nutrition, and Population Global Practice at the World Bank. And we've just had the wonderful news of more than $1 billion replenishment that we've just concluded with a big expectation of further leverage financing from the World Bank. So we are here with the co-hosts of the replenishment, and we will have brief remarks from each of the co-hosts of the replenishment, then followed by questions. So we'll begin with Her Excellency Erna Solberg, the Prime Minister of Norway.
Thank you. We are, of course, really delighted that today over $1 billion has been pledged for the GFF. This will enable the GFF to further meet the demand from countries that are already and willing to transform how they invest in health of women, children, and adolescents. The Norwegian government is pleased to be reaffirming its commitment to the GFF with $360 million of investment. It is a testament to the belief that we have in it, that it's an efficient and effective instrument in global health, working with countries to build and sustain health systems that women and children need to survive and thrive. I think we have had some good days with good discussions and good momentum, and I think this is what is part of what we have needed for the architecture of global health and global health investments. And there is today greater hope that the world's poorest countries can build both healthy, vibrant, and futures where no woman, child, or adolescent is left behind, an important part of reaching the SDGs for 2030.
Great. Thank you very much, Prime Minister Solberg. We're now going to move to our next speaker, who will be speaking in French. Alors, so if you are not fluent in French, there are headphones and translations. J'ai le grand plaisir d'introduire Son Excellence Roch-Marc Christian Caboret, qui est le président du Burkina Faso. Monsieur le Président.
Je voudrais tout simplement saluer la tenue de cette rencontre.
I'd like to say how much I welcome this gathering of which the object was to replenish the fund. I'd like to welcome this pledge for over $1 billion, and I understand there will be more pledges, more announcements. To me, the objective was to reach $2 billion, but what we have reached so far is very, very positive. And this positive result is a token of the importance given by organizations and countries to the GFF. And Burkina Faso has contributed, of course, modestly, only in view of its possibilities. But we have certainly committed ourselves on behalf of our peers, the other African presidents, to make sure that the domestic resources committed to health will respect the target set at 15% at the Abuja conference. And we shall try and make sure that all those that are not yet part of GFF do decide to become part of GFF, because it will foster health, it will foster better governance in the interest of the population of these different countries. I believe that this conference so far has reached the objectives required.
Now we're going to hear from Ms. Kristalina Georgieva, who is the Chief Executive Officer of the World Bank.
Thank you. I'm extremely grateful to the government of Norway, to the Prime Minister, for hosting us here. It is on a topic that is so critical for the future of women, adolescents, children, but also so critical for peace and security in the world, and it is so appropriate to be exactly in the place we are today. Why it is so critical? Because we are not going to win the war against extreme poverty unless we address the needs of those that are left out or left behind. And in far too many places, mothers and children are not prioritized sufficiently, then their health needs are not addressed and the health systems are not able to function to their fullest capacity. What we are aiming with the GFF, run by a small team with a very big mission and big impact, is to make investing in women and children the priority it deserves to be. For the World Bank, what it means is that on the basis of $1 billion replenishment of the trust fund, we will match with $7.5 billion in investments in the future of women, adolescent girls, children. And we would do so recognizing that the future development of countries depends first and foremost of the quality of their people, the health and education they receive. So let me conclude. What we are achieving is so commonsensical and yet for so far has been neglected. And it is to make this an investment case rather than just spending, an expenditure case. And that investment case today got a huge boost, a $1 billion boost to be exact. We will match it with $7.5 billion.
Thank you very much, Ms. Georgieva. And now we're going to have Ms. Melinda Gates, who's the co-chair and trustee of the Bill and Melinda Gates Foundation.
Thank you. I just want to say thank you to all the donors and commitments that were made today. I think today is a victory for the most vulnerable women and children and adolescents around the globe. I think it's important for us to all remember that today is a milestone on the way to a goal that we have. If we're going to meet and achieve the Sustainable Development Goals set by the United Nations by 2030, we need to be making these investments now, which we'll do with this $1 billion, and to make more investments in the future. And I know that everybody sitting up on this stage believes in a healthier world for children, adolescent girls, and women. We know that when you invest in women, they invest in everybody else. And so it's very encouraging to see this partnership today of so many people around the world. And I want to especially thank Prime Minister Solberg for hosting us today and for leading this effort and the unbelievably generous commitment from Norway to this fund. The foundation will be here to keep committing to GFF. And I also want to thank President Kabore for his leadership, not only in his own country, but in the Sahel region. So thank you.
Thank you very much, Ms. Gates. And now our final speaker will be Dr. Mariam Kleisten, who's the director of the GFF. Mariam?
Thank you. And of course, I would like to add to all the thank yous here, especially to our co-hosts that's on this panel, but also to the current and new donors who have come forward today. This is indeed a significant milestone for women, children, and adolescents today. We are so pleased with the generous commitments that have been made here today in Oslo that will enable the GFF partnership to expand towards the 50 countries where we have the greatest needs and where we have demand. That means millions or more young women, adolescent girls, children, newborn babies and their mothers, all accessing the care, the quality of care they need to survive and thrive. What makes this partnership so unique and today so special is, of course, the true commitments, the countries being truly committed to take the lead. And this includes committing their own domestic resources and committing to reach those that are furthest behind, those who are the last mile that we prefer to refer to as the front line and the first mile. As we had heard from Burkina Faso President Kabore today, this support is making a difference, but the task at hand is urgent. The demand and need from countries is there, and their commitment to drive sustainable change for their populations is there. So together, we are helping countries to transform the futures of their people by embedding the prioritization of health culturally, politically, and financially. So truly, today, I believe we are on the cusp of transformative change in global health, where no woman, child, or adolescent will be left behind. So thank you.
Great. Thank you very much to all our speakers and our co-hosts. So now we're opening the floor for questions. Just to say, we have questions here in the room, and we also have questions because we're live virtually that are coming in over the email. So, but we'll begin here in the room, and I have the gentleman here on the right with the glasses, if you can identify yourself.
Development today. I think that the many are welcoming this GFF initiative because of its broad approach to global health issues. But critics are also saying that GFF builds yet another layer of complexity, bureaucracy, and an already extremely complex global health aid architecture. And Sweden is not pledging today for this reason. So I'm interested in your response to this criticism.
Very good. Kristalina, please.
Well, it is really very important that we work so the whole is bigger than the sum of individual parts. The GFF is one of the most efficient platforms we currently have in the world. It has a total staff of 26. And what these 26 do is to make sure that at the country level, we bring together the governments, the health organizations like the Global Fund, Gavi, WHO, the private sector, civil society, and we come with an investment case that helps the country to prioritize investing in women, children, and adolescents in a way that is equal footing for all other pressing needs they face. And I can say this, when a country like Burkina Faso decides to put its precious money into the trust fund, that to me is a vote of confidence that I cherish, because it tells me that the objective of using this platform for a bigger public good is achieved.
Thank you very much. Prime Minister Solberg?
Well, I don't believe that this is more bureaucratic and more complicated. I think it makes it easier, because this is a system that is based on the national planning system of every country. You might say that asking a country to have a national plan on health is creating more bureaucracy, but I mean, you need that if you're going to measure if you're reaching your targets. So it even makes this, to have this in the bottom and have your own commitment that is enlarged by the DFF, in fact, makes it easier to use money in the right spots. So I beg to differ on that type of criticism. I think this was needed just because there's too many of those who are just following one type of objects. Here we are building from the development inside the own country, which I think is the most sustainable and also the easiest way. But of course, you need to have plans to get the investments and to get the support. But if you want to have results, you need to have plans.
Thank you very much. Next question, please.
Nina Jørgensen from Bistandsaktuelt, Norwegian newspaper. Also, there has been some criticism among others from Save the Children that this mechanism might create another debt trap for the countries to get involved, because they will invest in domestic resources, and then, as far as I understand, the IDAs will add soft loans on top of that. So how do you see that?
Great.
Thank you very much for this question. For us at the World Bank, this issue of debt sustainability is a top priority, because we do worry that debt levels during the times of low interest rates have gone up in many developing countries, actually everywhere in the world.
So we take a very careful look at how exactly to support development objectives, including those that are pursued by the Global Financing Facility. When a country needs grants or a very high degree of concessionality, on the basis of this plan that the Prime Minister talked about, of course, this is what we will support. We will support a grant or very high concessionality financing. So what we do want to see, however, and this is where the GFF has been phenomenal for countries, is that countries take a long-term view of how they use their own domestic resources, that they prioritize the tax revenues they generate, that they collect more of these tax revenues, and they finance priority interventions in the most efficient way. So actually their need to borrow go down, not up. And that is part of the work we do collectively.
Thank you very much. Other questions? Please.
Melinda Gates. As far as I understood, the Bill and Melinda Gates Foundation was a bit skeptical initially 3 years ago when GFF was initiated. Why were you skeptical and why were you convinced?
Sure. Sure, yeah. So we were skeptical initially when this first came forward because we didn't understand exactly how it would work or the specific pieces that were going to improve through GFF. And whenever we make an investment in something, this was true of Gavi when it first started as well, we go in, we're willing to take some risk with our money. Bill and I have always said that. We're willing to take risk, but we want to make sure it's smart risk. So we thought that the mechanism that was being set up looked good to us, but we wanted to see it play out, quite frankly. So with the first $75 million, it did play itself out well. We feel like the things that needed some improvement are being improved upon, just like Gavi and Global Fund. And because of that is why we came back with another $200 million. We have always felt that maternal and child health is really important, and we've been concerned that there hasn't been a good financing mechanism for it in the past. How exactly the grant pieces would work with the IDA funding and whether the governments in country would like that was another piece that we wondered about, and in fact, they've really liked it, and what the governments have been telling us is what they like about it the most is it helps them take and coordinate their players in country, create a national plan, but it's specific to their country. So if you look at, for instance, Cameroon's plan compared to Tanzania's, compared to Burkina Faso's, they're all slightly different because some countries are saying, I need to put more money into family planning for adolescents. Another one like Tanzania says, hey, I have a declining childhood mortality, I'm doing a pretty good job on that, but I have an increasing maternal mortality. So they like that it's custom to their country, but they're also learning from one another. The last thing I'll just say, and one thing Bill and I always look at in these funds are efficiency. So the fact that countries are learning about good procurement systems, supply and procurement systems from one another, that's an efficiency that can be carried across. And so that, again, made us want to put in more money.
And I could not stress enough the importance of this transmission line of countries learning from each other, and also reinforcing a commitment to women and children by seeing how that works in other places. And that I heard it also from the president of Burkina Faso, that in the Sahel region, that is a platform that allows Burkina, Mali, Chad to learn from each other. These are all countries that face quite formidable challenges, not least one of very high fertility rates and high population growth. They prioritize differently, as Melinda just said, but they do learn from each other.
Great. Any other questions in the room? I know that we have the press corps from Burkina Faso. Alors, si vous voulez poser des questions, vous êtes les bienvenus. Et aussi de Côte d'Ivoire. Alors, s'il y a des questions, posez-les si vous voulez. There are also some other media that may also want to. I'm not seeing any questions.
Maybe meanwhile I could respond to one question,
So,
a comment that was made, if
please,
I may.
Mariam.
Because there was a reference made to Sweden, so I just want to put the record clear that Sweden is an important co-financier of the GFF. They provide bilateral funding and actually pool and support the Uganda investment case. So Sweden is an important partner at the bilateral level in Uganda. And you made also reference to layers. There is one layer we are concerned about, and that is indeed to give countries more prominence as leaders of these processes. That's the one thing that we feel is so important to elevate here, and that is really central to our business proposition.
Great, thank you very much. I have not received any questions over the live feed, unless my tablet is not working here. But I've been assured it is working. Du er ferdig is what it says, so I think that means it's working. So if there are no other questions, then we'll thank our co-hosts once again. Oops.
Yeah.
Sorry.
Yes.
Keep asking. Well, also talking to other, well, let's say NGOs. I'm familiar with the situation in Mozambique, one of the African countries, and you talk a lot about the challenges in mobilizing domestic resources and taxations and so on. And then, you know, people whisper in my ear, well, if you just got rid of the corruption, you will have the money, you know. You say, you know, we'll never make the $86 per person, but maybe you would. If so, what's your comment on that? What is the most important, the taxation or the getting rid of the corruption?
Oh, everything is important for success in development. And one thing we do, and actually the GFF also contributes to that, is transparency. Put the investment case, what the money is needed for, how it is being funded, who is responsible, for everybody to see. So when we talk about efficiency of spending, of course, making sure that money doesn't get wasted, either because it is being squarely stolen, which is the worst case of waste, or because it is inefficiently used. Transparency helps enormously. Through the investment case, everybody's contribution is put in the open. And one of the risks that we often face is that different parties fund the same objectives, but not in a transparent manner. That is being dealt with. And I cannot tell you how important it is. The sunshine, you don't have that much of it in Norway, but sunshine is the best disinfectant. Transparency works miracles.
The other thing I would just add that I think one of the pieces that's very encouraging in all of this work that helps with the transparency and corruption and ultimately tax is the digital ID system and digital money. You're seeing digital currency at scale in countries like Tanzania and Kenya. You're seeing Malawi's putting in a biometric ID reader. India, when it started running its government payments, they have a digital ID now. When they started running their government payments through the digital ID system, they cut down their corruption immensely. So I think the digital system gives us a whole way of more transparency, less corruption. And over time, the goal is for these countries themselves, they want to eventually be able to have their own taxation system and economy. Any country that moves from low to middle to high income has to have a good tax policy over time. So they'll grow that as it makes sense. But you can't tax very much when you're still a very low income country. But I'm encouraged that they will get along there. And one of the great things with the World Bank is that people eventually do graduate out of IDA and go on to other forms of loan and then self-sufficiency. And that is the goal. Much like helping South Korea start from a low-income country that we can all remember to middle income to high income, that's the goal for all of these countries and what they want for themselves.
Great. If I could just add on that one of the benefits of the GFF with its link to the World Bank is it has access to experts who are not only health, nutrition, population, but who are governance experts. And they've been helping to modernize public financial management systems electronically in many cases. And so one good example in the health sector is that sometimes you get workers on the health rolls who are no longer there. They've migrated, but they're still drawing on the public purse. They're often called ghost workers. And I think what we're seeing with good public financial management systems that we bring to every project, because we want to get good value for money, is we've seen some of those ghost workers being shed from the public roles because of modern public financial management. And I think that's part of the benefit and why aligning around building country systems can get you as much as 40% more value for money. We discussed this yesterday at the Domestic Resource Use and Mobilization meeting, beating the drum. And this is really much how the GFF is really pathfinding in health to bring much better value for money in addition to more domestic resource. There was another question beside.
Hello, I'm Sarah from the Telegraph in the UK. I was just wondering, obviously the money is all talking about maternal health and women's health as well as children and adolescents. In countries where there's perhaps deeply embedded inequality in politics or in society, how do you make sure that that money does actually go to women, and what safeguards are in place to make sure that happens? Thanks.
I mean, when we work through the projects that the World Bank supports, we have very well developed tracing system, and we look at where the money is going, who is responsible, what is the impact. We are also much relying on civil society, on the eyes of the citizens. And in everything we do, we have open data. We also have 100% engagement of civil society to make sure that in addition to what we do, we have the citizens to help us do it. The World Bank has gone a long way since 1996 when our president then, Jim Wolfenson, gave his famous speech on the cancer of corruption, to uproot corruption and waste from our projects, but also to help countries themselves have procurement systems. Melinda talked about the use of technology, transparency that technology brings, to make sure that every penny goes for the purpose it is designed to serve. Those of us who have worked in fragile environments, we know the difference small amount of money makes. $10 can make the difference between life and death for a child. So you can be sure that for us at the bank, we bear this responsibility with great sense of the significance we have, and we are very grateful for the trust that is given to us. Do push us. I actually very much appreciate you putting forward these questions. Push us. We always want to, we know everybody can do better. We always want to do better, and we rely on civil society for that.
Very good. Well, we need to wrap up, just one final question that has come in is, will there be more fundraising today, and when will it be announced? That was from Devex. So, any other comments on that?
Well, never too late to do good, so.
Anybody who has money can just come with it.
Right. Okay, well, with that, thank you again very much to our co-hosts, and thanks for all of the great questions. And with that, we'll conclude the press conference.
Ladies and gentlemen, the conference will start shortly. We kindly ask you to take your seats. Thank you. Ladies and gentlemen, the conference will start shortly. We kindly ask you to take your seats. Thank you. Ladies and gentlemen, the conference will start shortly. We kindly ask you to take your seats. Thank you. Ladies and gentlemen, the conference will start shortly. We kindly ask you to take your seats. Thank you.
Ladies and gentlemen, if you could please take your seats, bring your coffee, your tea, your water to your seats. We're going to begin. Almost at time. Ladies and gentlemen, on this greatest of days, in this wonderful hall, we have about 2.5 more hours together. I hope you've all had a wonderful lunch. Vous avez bien mangé? C'était bien? Reposez un peu.
Did you manage to rest and eat? And you have a lot of energy. Perfect.
Start with our first of what will be 3 panels. And I have the joy of sharing the stage with 3 other excellent moderators. Our first panel this afternoon will be country-powered. We're not just leading now, we're powering on. Country-powered investment in every woman, child, and adolescent. And this session will be chaired by my compatriot, Tim Evans, who's the Senior Director of Health, Nutrition and Population for the World Bank Group. He's got a big and powerful panel, and I'm going to read out the names so that you can come and take the stage along with Tim, starting with you, Monsieur le Premier Ministre de la Côte d'Ivoire, Amadou Coulibaly, qui est ici, je pense. Il est où? Oui. Il vient venir. Avec Atupele Muluzi, who's the Minister of Health of Malawi. Sambaso, who's the Minister of Health of Mali. Sara Opiendi Achieng, who's the Minister of State for Uganda, State Minister of Health for Uganda. Aminu Magashi Garba, Coordinator and Founder of the African Health Budget Network. And last but not least, Membri Mbewa, who's a child rights activist from Malawi. Please join us on the stage. Give him hell. Give him hell.
Great. Well, welcome back. We hope you've enjoyed that lunch in this beautiful, beautiful hall. We're energized by the new $1 billion commitments that we just heard this morning, plus the $7.5 billion that will come from the World Bank linked to those investments. But this is the panel, as Lise just told us, about really the heart of the GFF. And this is why it's so important that it's the first panel, because this is all about country leadership and ownership. And this really is one of the most, this is the big C in what Lise Doucette identified as the vitamin C of the GFF. But it's not only the catalysts and the collaborative and collective, but it's country-led. And I think this is a great manifestation. We have 6 leaders with us. 4 of them occupy ministerial positions, and 2 of them round out another critical dimension of the leadership in countries, which are civil society. And we've got a good age range here, from somebody who's in their 20s to somebody who's almost reached the centenarian age group, who will remain unnamed, who may be speaking at the moment. But having said that, we are going to have initial comments from our panelists of 3 minutes, and they're going to give you a sense of why and how they're moving the issues that are central to the GFF, mobilizing their health systems for the service of every woman, adolescent, and child. And we're going to begin with Minister Samba Sow from Mali. He's a doctor and an epidemiologist, and one of our Ebola heroes. So, Minister Sow, tell us, how are you going to take advantage of the GFF moment in Mali? And if you would like to take the podium, I understand you'd prefer to stand. Please.
Thank you. Thank you, Mr. Chair. Distinguished guests, honorable ministers, presidents, honorable prime ministers, dear colleagues. Great question. I can't come from Mali and only spend 2 minutes. Please, Mali has a very special situation. Let me share some of the real life with you. Mali has invested never sufficiently nor effectively in health and nutrition of women, children, and adolescents. Why? North of Mali is part of a border crisis across the Sahel region and subject to exceptional circumstances and conditions, including climate change, through nomadic migration patterns, various independence movements, security issues, etc. All these coalesce. No one country alone can address the situation. No one ministry alone can address the situation within Mali. Ministries, countries, and international communities must come together to address this exceptional situation, this crisis, such as the G5 Sahel. Mali has experienced 10 years of turmoil and varying forms of instability, but only in the north predominantly. The south is fine. The growing concern is the center. The center is wavering. Although some progress has been made in Mali in areas such as nutrition, maternal and under 5 mortality ratios, and the provision of family planning services, the progress is totally insufficient. The fact is that Mali is facing a perfect storm: poverty, security threats, demographic shift, and huge migration shift that are concentrating population more and more in the south and around Bamako. If we are to hold the center and if we are to preserve Mali, we must provide fundamental services to the population, and particularly fundamental healthcare services. The current funding of healthcare in Mali is grossly inadequate and not sustainable in the long term, relying predominantly on external donors, funds, and increasingly out-of-pocket expenditure by a population that cannot access even basic public health services. What is the proof of this alarm? Mali is one of the 25 countries in the world spending $50 or less per year per capita on total health expenditures. Domestic public health expenditures represent 4.5% of the total government expenditures and 16% of the current total expenditure. External health funding represents about 36% of the current total health expenditures, and out-of-pocket about 46% of the total current health expenditures. The healthcare system in Mali is broken. Primary healthcare in particular is broken. Primary healthcare centers are in disrepair, poorly managed, understaffed, providing an inadequate health products and services of very poor quality. More importantly, access is becoming increasingly unavailable to a relocating population living too far from the existing healthcare centers. Most importantly, women and children are not being adequately reached by the current healthcare system. What is the proof of this alarm? Mali is among the 5 countries in the world with the highest burden of disease. On average, about 160 women and children under 5 die every year. The maternal mortality ratio dropped to 587 in 2015, far above the SDG target of 70 for 2030. Mali has the world's second highest national under 5 mortality rate in 2016. Unmet need for family planning dropped from 30% to 17%, but alarmingly, Mali still has highest adolescent age-specific fertility rate in the world, with 17 births per 1,000 women aged 10 to 14. Nutrition outcomes indicators have not improved since 2009. Child nutrition remains a major impediment to ensure optimal accumulation of human capital in Mali. We are squandering an entire future generation in Mali. The demographic transition and demographic dividends are central to the discussion of both health and economic growth in Mali. But while Mali has started its demographic transition, the pace is too slow in Mali, and Mali is now at extreme risk of not harvesting this essential demographic dividend. But all is not lost. As I said, all is not lost. The fundamentals are in place, albeit very poorly coordinated. Malians and the international community must remember during Ebola crisis in 2014-2015, Mali confronted this crisis on its own with very little resources. Mali relied on Malians, on the resilience of its population and community spirits. The community come together, the civil society come together, the government come together with the full support of authority of the president of Mali and his office. We confronted this crisis and came through it. It might say, if I might say, on a personal level, I confronted this crisis when I was the special advisor to the president in response to Ebola. I had no choice. I had to deal with it. Mali also has no choice. It has to deal with this crisis. There is a bedrock of capability and resourcefulness in Mali. We can harness this. We can build on this. We have a plan of intervention for this crisis. Our plan, we are going to reform the healthcare system. Thank you.
So thank you very much, Minister So, for giving us in harsh and honest detail the magnitude of the challenge being faced. Our next speaker, as we heard from the Prime Minister of Ivory Coast today, our next speaker will also be speaking in French, but the Minister of Health, Monsieur Wete Eugène, is a pharmacist and somebody who brings huge private sector experience. And as we heard this morning, Côte d'Ivoire, Ivory Coast, has made a big turnaround since 2012, having been in a place that wasn't too far from Mali prior to that. So, Ministre Wete Eugène, est-ce que vous pouvez nous expliquer un peu qu'est-ce qui se passe maintenant en Côte d'Ivoire?
Maybe you could, Mr. Minister, explain a bit about the situation in Côte d'Ivoire at the moment and how the GFF can support you. Thank you very much, Mr. Moderator. This morning, we heard the Prime Minister from Côte d'Ivoire who explained a bit about the health policy. And I think he committed the whole government to GFF goals, of course under the authority of the president. What happened in Côte d'Ivoire? Well, it's true. We had a 10-year crisis, a very deep crisis. The crisis ended in April 2011, approximately. I think we have to thank His Excellency Alassane Ouattara, our president, for this. He managed to present a very clear vision for a country that needed to be an emerging country by 2020. He's an economist, and he knows very well that if you want development, well then you need to invest in human development. You need to invest in health services. That is, of course, the investment that gives the most return on investment. His vision is very clear. We need to build a health system that is very efficient, a system that can guarantee that everyone is in good health. And of course, this has to help the most vulnerable parts of the population first. We know that that part of the population is often composed of women, children, and adolescents. The president's policy is focused on these vulnerable groups, and we have two pillars for this policy when it comes to financing of this vision. First of all, the government and the president want to have an increased level of funding in the health sector. We also need to monitor that the funds are used efficiently. The second pillar we're basing this policy on is an increased coverage of the population. And as I was saying, it's the most fragile parts of the population. They need to be protected, and we need to do preventive work to prevent diseases from spreading. We need to act vigorously. We want free healthcare for targeted parts of the population, mothers, and also for children under 5. We also want malaria to be covered. Fighting against malaria is one of the priorities of the government's policy, but we have all other actions that are important too. We need to fight against malnutrition, undernutrition. We've adopted a multi-sectorial plan to fight against malnutrition, a plan from 2016 to 2020. We also need to reinforce the coverage of mothers who suffer from postpartum hemorrhaging. Those are parts of the important actions that are being taken. We have family planning as an important plot. We need contraception to spread in order to improve the general health situation. Our health system is now on its way to prepare tomorrow's generation. We are protecting our children today to prepare a new generation and hope to meet our goals by 2020. Thank you, Mr. Minister.
How critical it is not only to have the highest level political commitment, but also a whole series of follow-through which relate to restructuring your sector, both in terms of what it does and how it's financed. We're going to move now to Minister Muluzi from Malawi. You're a lawyer, and you're distinguished on this panel because I think you've held the most ministerial posts, and including economic planning and development, as well as at least 3 others. So you've got a big legacy in governance. How are you going to make your contributions to the health sector, and for every woman, adolescent, and child, the most important yet?
Thank you very much, moderator. Malawi has made progress in recent years in a number of health indicators. And I think what I can say is perhaps extremely important has been our commitment to free access to healthcare at all public facilities throughout the whole country at a point of entry. And this has been a central pillar of the government, despite the challenges with the pressures on the economy and, of course, the pressures that come with that. At the same time, we have been able, through this, realized some very good outcomes, the impact that it's had on maternal and neonatal survival rates, on dealing with HIV, TB, malaria, and of course we've also seen the life expectancy improve from around 32 years in 2004 to around 67 years in 2016. So remarkable progress, and mostly that has been to do with very much related to the interventions on HIV in Malawi as well. We are also committed to delivering universal health coverage through an essential health package that is very much a model for the region, through which we ensure that we continue to maintain this despite the increase in the population and, of course, a stagnant economy as well. So Malawi has been a very good example of doing more with less. And I think we have achieved a great deal. With regards to reproductive, maternal, newborn, and adolescent health and nutrition outcomes, despite this, we still have perhaps one of the largest maternal and child mortality rates on sub-Saharan African continent. So there are real challenges, and of course, the way we've attempted to dealing with this is an evidence-based approach for interventions and making sure that we maximize the results through the investments that are coming in. So the idea of coordination and maximizing investment is absolutely critical to delivering for Malawi. If I may just highlight some of the 4 key areas in terms of intervention. So the review of the essential health package is essentially being underway to make sure that it caters for the need, especially for women, adolescents, and children, so that they have access to the services they need. I think access is extremely important, and of course making sure that they don't suffer any undue financial hardships when they're accessing the services. We've also over the years improved our community-based interventions through our health surveillance assistants, community health workers, and community engagement is a key component to the health sector interventions. And of course, investing in frontline health workers, which is absolutely critical. The only challenge is that we have about a 50% vacancy rate at the moment within the health sector. So this is something that we actively are dealing with. And then, of course, what is also encouraging is a multi-sectoral approach of the implementation of health in Malawi. And nutrition. We've just recently launched a multi-sector nutrition policy that is a government-wide intervention. And of course, the multi-sector approach to health is something that we're strongly encouraging. And of course, strategic partnerships. So we recognize that the public, we can't do everything alone. We have at the moment, our policy is that there should be a health facility within an 8-kilometer radius for the population. We can't always achieve that, so we are leveraging opportunities through, for example, the Christian Health Association of Malawi, where we do provide services to those that can't find a public health facility. So limiting out-of-pocket expenses with partnerships. And of course, the other area, and I'm very grateful that on this panel we have Chimwemwe here, because she will be able to give us insights in terms of the perspective of the youth. So the youth-friendly health services, making sure that there's greater access, making sure that there's greater access to family planning services is also one of the key interventions. If I can just quickly also touch on, just very briefly, what I think is an absolutely critical opportunity. So Malawi is very fortunate at the moment that we've just rolled out our first national biometric ID card on the continent, which then provides us an opportunity for e-health, for targeting, for decision-making that is very much data-driven, and of course at the same time leveraging this to make sure that we can also improve supply chain, so end-to-end tracking, so that we're getting commodities right from store to the last mile. So these are the transformative things that are happening in Malawi, and of course I'll come in later to comment on other interventions as well.
Great. Well, thank you very much. So, massive challenges, great progress, and then a very good comprehensive support set of reforms. But I do want to mention your biometric ID, because it brings a dimension of innovation. And I think this is going to be so important. If we can get to every woman and every child and make sure they're registered, then they're part of the system. And too often we're not registering that population, women and children, and therefore we don't know. We don't have the real denominator. So there's a huge opportunity, I think, to try and get to every woman, every adolescent, every child with a real identification. We're going to switch now to Uganda, and we have Minister Sarah Cheng with us. Sarah is an MBA, a Master's in Business Administration. She has a vast experience in both local government, working on anti-corruption, and also working in the private sector. So, Minister Cheng, give us your sense of where things are in Uganda. You were one of the front runners in the GFF. How are things going, and where are things headed?
Thank you very much, Tim. It's a pleasure being back on the panel. And I just want to state that there is no great gift that any government can give to its citizens other than investing in healthcare. Because without health, you cannot talk about economic development. Even if you constructed the best roads, without health, nobody will use those roads for economic development. It will be there to transport patients to the hospitals. So I'm glad that my government, the government of Uganda, after the Almata Declaration, did embrace it, and of course we have the primary health care services across the country provided free of charge to the population. Previously, before we made significant investments in healthcare, the maternal mortality in my country was quite high. Under 5 mortality was quite high. The infant mortality was high. Malnutrition was quite high, with about 38% of the children under 5 stunted. But over the years, with increased investment and ensuring that healthcare services are accessible within a 5-kilometer radius, we've seen a significant reduction in the number of children dying before their 5th birthday. We've seen a number of mothers now, of course, deliveries were also, as I said, mothers used to lose their lives while giving birth. Of course, although the maternal mortality is still high, but we've seen a reduction from over 500 mothers dying to now 360. And of course, this has been in a spate of about 10 years. And we hope that this will reduce further with now improved funding and of course focusing on quality of care and of course the support from the global financing facility. Uganda of course has had a roadmap following the Almata Declaration. We've realized that we need to focus more on maternal and child health. So we came up with a roadmap for maternal and child health way back in 2006. And of course, you can have a roadmap, but if you don't implement it, if you don't invest and focus, then you'll be off target. So with this roadmap, we were able to ensure that we look at where the issues are. The resources are one aspect, the human resources are another, and of course, with support, a lot of advocacy from the civil society organizations, I must acknowledge, government was able to increase funding, and as we speak now, the human resources in our health facilities, if you look about over 10 years ago, were just below 50%. But as we speak now, the human resources, at least in every health facility, you'll find the critical staff, the clinical officers, you'll find the midwives, the nurses, and of course, now we are talking of staffing levels of up to 80, some even 90%. So we have been able, with the GFF now in place, to also strengthen, build capacity of the human resources. Our focus now is not just talking about providing health care, but we are talking about quality of care. You know, it's one thing to give health care, but is it quality health care? If I get to the health facility, will I find clean water? How is the environment around the facility? So this is the focus area so that we can really make our health facilities safe, so that you don't walk in there and walk out with a different disease altogether. So when GFF came in 2015, of course, we had also, the roadmap was there before, but we now had a sharpened plan, which was launched in 2013. So with the GFF, we were now able to review this sharpened plan, and we went ahead and developed the investment case. So we have an investment case, and this is one of the accomplishments after the GFF. We have harmonized support with the partners. As I said before, sometimes you have a lot of duplication, partners in one district almost doing the same thing. So we have now been able to harmonize this support, and of course, financing is also based on the investment case. We have also developed and finalized the health financing strategy, which is also another important tool that we have. And of course, with this strategy, we should be able to see better utilization of funds, of course, sustainability. We do appreciate the support from the various partners, but we are aware that these resources globally are diminishing. We cannot completely sit back and wait for Gavi, wait for the Global Fund to fund our TB, malaria, HIV challenges in the country. We now have established an HIV Trust Fund, which is up and running as we speak now. There is some, of course, Parliament. We took a bit of time coming up with this law, but just about 2 months ago, we passed the regulations, and the operationalization of the HIV Trust Fund will now be in place. We have the Immunization Act, which also creates the Immunization Fund, so that if in the event that Gavi does not support the immunization wholly, then we are able to, at least as a country, move on and sustain the gains that we have made over the years. So, of course, we have also been able to have the results-based financing, which we have rolled out. And of course, as I did indicate, we adopted the primary health care model. And health care is provided free of charge. As we speak, close to 80% of the population is at least within 5-kilometer radius. Now with funding from the GFF, we are going to, yesterday I was talking about flexibility. We are going to construct additional health centers in those areas that we did not have, actually about 84 of them. And this, of course, will go into reducing the number of the populations by maybe about 10%. So this GFF, I want to really appreciate all those who have put in funds, and it has been helpful to countries, but as I said before, the best investment that any government can give to its population is health. And health should not be looked at as an expenditure, but as an investment. Thank you very much.
Thank you very much. So lots of progress, And it's clear, building on yesterday's theme, you're beating the drum on many fronts in order to prepare for managing your own system towards higher performance in the future. Wonderful. Our last but certainly not least speaker here, although you are the youngest, I believe, is Ms. Memory Mbewa. Memory is a child rights activist. She's got a business education background, and she spends her time on something called Timveni Child and Youth Radio. And Timveni, I'm told, means hear our voices. So we're ready to hear your voice. Timveni.
All right. Thank you. So I should say thank you to the leadership of GFF, and particularly Kathleen and Plan International for the opportunity to be here and share the experiences from the ground. And also, I'm so pleased to share the platform with my Minister of Health in my country. And as he has pointed out, I spent my time with Timveni Child and Youth Media Organization, which is a media house where we look at the rights of young people all together. So most of my work is interacting with young people in the communities and seeing the challenges that they're going through and telling them of the rights that they have and trying to coordinate and see what is there that maybe the government or stakeholders are doing for them that they do not know about. I should say that it's actually nice to be here and to see that there are a lot of people that are pledging towards helping the welfare of children and of adolescents as well as women in the communities. Because when you are there, that's when you see the real issues that are happening. For me, in all this that we are pledging on the investment in making sure that health care is available to everyone, there are certain things that I would want us to consider as we're doing the investment, because this is what we meet on the ground. To me, I should acknowledge the progress that my country and many other African countries have made towards making sure that children and adolescents are protected from all various harms, and we have come up with policies and strategies and laws that have been put in place to assist the process, and which is a very good thing. Like now in my country, we have the National Strategy on Adolescent Girls and Young Women, which is a very good strategy that is going to coordinate all the initiatives that stakeholders are going to be doing as they're implementing the process. But the biggest challenge when I'm on the ground is that these policies that we have come up with are never implemented, and this is because there are never enough resources to implement these policies. And implementing these policies would mean training the policy implementers. We're talking about the magistrates, we're talking about the chiefs, we're talking about community leaders, and we should also be able to educate the communities. I'll give an example of the law that we passed on raising the marriage age to 18. And it's pathetic sometimes when you go in the villages, because the communities have not been educated on what is this law protecting us from. It's because they've never understood that, and you see that parents are waiting for the 18th birthday of their child so that they can marry them off, when in fact we've put the age because we want children to have a chance to be protected from teen pregnancies, to gain some sort of independence as they go to school. And this is because we have passed really good laws, but we have not invested in the implementation process, and we have not translated the laws and made it available to the locals so that it benefits them, because they're the people that need it most. And sometimes you see that cases maybe in the police station, they're held because they don't have the most updated of books that are available, because we have not invested in that. So these are areas that I would want us to invest. And also we're talking about that maybe keeping girls from getting married young, and maybe keeping women from, maybe making women to go through the wonderful processes that we have of childbearing in the hospitals. But then we have not offered alternatives. We are saying they should not marry young. What should they be doing as they are waiting to get married? Because it doesn't make sense if we're telling them don't marry young and then they don't have a school close by to go to school. They are idle. What else do they have to do? So we have to offer alternatives for the things that we're saying. If we're saying that they should go and give birth in the actual clinic settings, then we should make it available, because now we have the traditional birth attendants in the communities. These are women that are experienced, and they can help another woman to give birth. And this is what we are discouraging, because they're not trained. But then there are no healthy centers in the communities. It means we have not offered the alternatives that we want them to do. So this is pretty much part of the implementation process. And I would want us to, as we are addressing issues of children, adolescents, and women, to target the men as well, because it doesn't make sense if they have a part to play in the process. Everybody in the community has a responsibility, and every member of the community have to know the responsibility that they have, and we have to offer them a chance. If we are saying that women should access sexual reproductive health services, we need the men, because there are things like practices that are there in the communities, maybe misconceptions that as a man, you can't, your wife or your partner can't tell you that we should use contraceptives, because these are misconceptions in the communities. Why not use these misconceptions for our advantage, to say that we target them, we tell them, why are we saying contraceptives should be used? Why are we saying that women should access the right information to sexual reproductive health? Because then they'll be on the forefront to say that, yes, our women need this, and we need this. It's for our future, not only for the future of the women. We still have to target the men, because we're not targeting at creating a war between men and women or boys and girls. So we need to get everybody on board to fight over this. And lastly, and most importantly, I would say that we involve young people. Involving young people is not just about bringing them to meetings where they can contribute and say what is on the ground, but there are very passionate young people that I've met in my line of work that are doing tremendous initiatives, and we need to support these initiatives, because they are there on the ground. They know the challenges, and they also know how to solve these challenges, and they use the little resources that they mobilize within themselves to address the challenges that they see in the communities, to maybe help other young people. Why don't we come down and learn from them and support in these small initiatives that they're doing? So I think it's great we can do this.
Great. Thank you very much, Memory. And optimism in seeing that misconceptions on contraception are an opportunity. And what we have is not simply the involvement of youth, we have youth leadership. Fantastic, thank you. Now, our final panelist with our remarks, introductory remarks here is Dr. Amina Garba. And Amina is a doctor, a student activist at medical school, as well as a journalist. And he runs the Africa Health Budget Network, which is a Pan-African civil society organization that's looking at mobilizing more and better use of and better accountability of public finances for health. So, Amina, tell us, what do you see as the next steps for the GFF?
Okay, thank you so much for this question. What do we see next for the GFF? Today, we have a pledge of over $1 billion US for the GFF Trust Fund. Now, this is one side of the coin. There's additional money from the IDA, from the IBDR, and also from the domestic resource mobilization. What it means is that there is going to be a lot of financial resources coming into the countries to deliver the mandate along with the investment case. So to me, that is an opportunity and also at the same time a challenge. Opportunity, there's going to be additional resources to implement the RMCA strategy, and also a challenge to ensure efficient allocation, spending, disbursement, and expenditure. I was congratulating Miriam the first person to give her a big congratulations, but I told her the CSOs are going to track the money. So the CSO will be tracking the money, tracking the money not at the secretariat, but as the money are going into the countries, the CSOs will be tracking the resources. How much enters the country, how much the government mobilizes from the country, how much the private sector contributes. Now this is the pot of fund from the GFF, from the government, from private sector, from contribution. This money needs to be tracked very well. So there are simple indicators. I always challenge people. Budget tracking is not complex. We should start from the simple indicators. How much has the government allocated annually to deliver what the government promised? The Honorable Minister from Nigeria has pledged on behalf of Nigeria $150 million in 2018 and 2019. That's the indicator. So we'll track the money to see how much is disbursed in the next 6 months, in the next 1 year, and what is the outcome. What is the positive outcome of these resources? So we should be engaging in scorecards, trackers, independent GFF observer to know what is going on around the GFF. And also the last one I also want to say is the access to information. So in doing budget tracking, if there's no access to information, it cannot be done. I always tell the people, if I'm doing a training, you cannot track what you don't know. So I want to encourage the countries to commit to also improve in openness of the data so that people can understand, connect, and critique the data to inform policy and program. So a part of the CSO communique that was launched on Sunday, we are calling on countries to improve transparency and accountability, and I want to use the opportunity to encourage the leaders. The more you open the system, the more your people know what is going on, the more they give you a feedback, and the more you deliver your mandate. So it's a win-win when you open the data. So this is my last word. Thank you.
Fantastic. All right. So it's always good to finish a panel with a triple win, but I also think, Aminu, as somebody who was a youth leader, you're still youthful, and you're bringing, I think, what one of our panelists says yesterday to recognize that in everything we do, the real treasure is what we measure. And Natalia, I'm not sure if I got that quite right, but Natalia Conham, our executive director of UNFPA, I think, brought that to bear. And I think that's a fitting way to finish our panel. I'm going to give you each 30 seconds, and only 30 seconds, because in the initial 3 minutes, we suffered from a little bit of inflation. But if you had 30 seconds with your Minister of Finance, okay, what would be your 30 seconds to say, we have to move the needle on maternal, child, adolescent health? 30 seconds. Qui veut commencer? Okay, Dr. So, please, you have 30 seconds. I'm timing. 28, 27, 26.
Things are so serious in Mali. That's why I have to stand up. I'm ready to go for this. 30 seconds. I said that we would like to do the healthcare system reform. This is what we are going to do. We want to do these reforms in 3 phases, exactly 3 phases. One initial 200 emergency plan to pull together a business case intervention plan for phase 1 and phase 2. And then phase 2 will be looking at the next, phase 1 is in 200 days. This is emergency. The next 200 days. Phase 2 is 3 to 5 years. We will concentrate on reforming the community health centers. We call them in Mali CESCOM, Centre de Santé Communautaire, as we'll call them, and building national community healthcare worker program. And phase 3, that will reform the second layer of a primary healthcare system and provide district level that we call district referral health centers. So we believe that if we manage to do that, we'll be improving the nutritional status of women under 5, we'll be screening and treatment of the most killer diseases, delivering frontline vaccine through community healthcare workers cadre, delivering family planning and sexual reproductive health services initially focused on teenage pregnancy. We'll be providing school health services that will result in healthier children. Lastly, not the least, we must implement fundamental tax reforms, and finally, we will learn from each other and at the regional and global level. I would like to thank my country, thank the government of Mali, thank the healthcare workers in Mali. They are doing a very hard, difficult work. I would also like to thank again organizer. If you help me, we want to use the GFF to invest on this. If this happens, I might, in the next coming 3 or 5 years, become a girl, because girls and women and children in Mali will be top. Thank you.
Dr. So, your 3-phase plan, I think, and your final statement there, I'm going to take my moderator's prerogative and say that it speaks for us all. I've been given rather subtle signs in Norwegian that were sort of like this, very subtle, that we have to draw this panel to an end. But I would like to finish by thanking you, our country leaders, for really stepping up and leading us forward on this replenishment. Thank you very much.
What a terrific panel. 2 amazing civil society activists, 4 ministers from East to West Africa, from what Tim described as a harsh and honest account of an entire generation being squandered, to from Uganda talking about the gift of health. Merci beaucoup, mille merci. C'était très, très bien. Thank you too, Mary. Thank you. Merci. Thank you very much.
You didn't want to leave the stage.
Yes, you can stay if you like. You can stay. Well done, Tim. And I love this idea of a scorecard. I think we should take this idea up immediately about everyone getting a score on whether they're keeping to their promises. But now we're actually going to build on what Memory Mbewe told us about the misconceptions about contraception. Our next film, prepared by the Netherlands, entitled Nothing About Us Without Us, are the views of young people who are part of the partnership of the GFF, who are asked about their ideas and wishes when it comes to sexual and reproductive health. So let us listen to them.
Hi everyone, I'm Negaga Matilda Rita from Uganda, age 21. Well, we are here to talk about contraceptives. Most health service centers in Uganda have nurses that are over our ages. So it wouldn't give me a lot of comfort if I walk into a health center and talk to a big person about something I need, let me say a condom, any information about sexual reproductive health.
Why many girls get pregnant when they are still young is because they have not accessed school. Now for those in school, they should access the information, and also at the community level, the government should set up a forum where information is spread both at the community level and at the school level.
A minha preocupação está na fraca qualidade de informação e de serviços prestados.
A falta de serviços amigáveis nos centros de saúde.
Contraception helps us know our body, know the decisions we're supposed to make, and when to make them. With the GFF, it can help in creating these safe spaces where they could come in, sit down, relax, get the information, get the services, but at their own pace and on a silver plate.
En tant que jeune ambassadrice de la santé de la reproduction et de la planification familiale au Burkina Faso, j'attends de mon gouvernement l'amélioration de l'accessibilité géographique et financière des jeunes au service de santé de la reproduction, adaptés à l'opportunité du mécanisme de financement mondial.
Uma das melhorias seria fazer chegar a informação em lugares recônditos. dar a conhecer os serviços que são gratuitos, sabemos nós, e mostrar, né, que vale a pena aderir aos serviços e conhecer a própria saúde sexual e reprodutiva e a contracepção em si.
En tant que jeune, je sollicite auprès du GFF d'accroître les ressources allouées aux activités destinées aux jeunes et surtout en matière d'éducation sexuelle complète.
Dispensar mais meios para que a informação seja difundida para a maior parte da população.
Salam. I am Yordano Swelde from Talent Youth Association, and I'm concerned about youth reproductive health. Can you imagine how many young people would be able to join the working force if these issues are addressed, and we would be able to meet the global goals just by investing in adolescents and youth?
We are the young people. Our voices matter. Our information matters. Our opinions matter to create a safe spaces for reproductive health and rights.
Young people need contraception to help them have double protection upon their lives. Double protection, I mean having protection over their life, not to get STDs, and again, to protect themselves from unwanted or early pregnancies. As you know, it's a problem that we experience in Uganda in the young people.
Oh. The voices of the young people, and they will inherit your choices, your commitments, not just of today, but of the next 5 years and beyond. It's all about partnerships, and this is the theme of our next panel, partnerships and accountability. And it will be moderated by Katja Iverson, who's the president and CEO of Women Deliver, and Katja will certainly deliver. On her panel, Diane Jacuela, Deputy Minister of International Development from Canada, Joanne Carter, Executive Director of Results, Marianne Etibiet, Executive Director, Merck for Mothers, Charlotte Petri-Gornitska, Deputy Executive Director for Partnerships for UNICEF, and last but not least from Nigeria, Clara Metier, who's the President of the Healthcare Federation. Bonne arrivée. Merci. Wow, all women. I think we're ending up terrifying the men, this all-women panel.
Not that one either. Yes, it was. You're not going to shut the women up, no? Hello, honored guests, friends, colleagues. It is such a great pleasure to be here. And could we just give a hand for that replenishment of $1 billion? Thank you. If I look at one thing that has helped deliver that, that's partnership. We've really seen a great partnership in the build-up to this replenishment. It's been a joy to be part of it and see how everybody pulled together, whether it was CSOs, governments, UN agencies, and everybody else. It was really great to be part of that. So we will continue the discussion about the importance of partnerships here. And as coming from Women Deliver, I couldn't find a better topic to talk about and to talk with this distinguished panel about, because we say, kind of, partnership is in our DNA. We're nothing in ourselves. We are only something in the people we work with and what we can create together. And if we're serious about women's, children's, and adolescents' health and delivering health for all, it will have to happen in partnerships. We know that we're stronger when we break down silos. We know that we can deliver the most powerful, meaningful, and comprehensive results with and for, with as a key word, with women, children, and adolescents when we work together. And we also know that it just holds truth in delivering the amazing task we have in front of us. It's one of the greatest fights, health for all, in this time, to really make sure that we can all agree in this room that it's important, but when I look at the world, I'm not sure everybody thinks the same. So in partnerships, we can change that When we look at the Sustainable Development Goals, it's been said, the SDG 3 is crucial, health is wealth, but it's also important to deliver on the other ones. And the partnerships around integration and around not just looking on health as health, but also looking at nutrition, education, gender equality, WASH, and the other issues, that's also what will help us deliver. So we will talk about today how best to apply the all hands on deck spirit that we have to embrace if we want to deliver, and also how best to hold each other accountable. Because we can have the best plans in the world, but if we don't look at how it's delivered, if it's delivered, and hold ourselves and each other accountable, it'll just be beautiful, beautiful words on a piece of paper. So my 3 messages to you, just to start, what was it you called it, Tim, the moderator's prerogative? If we only treat health as health, we're never going to we're never going to succeed. When we work together, we are more than the sum of the different parts. We're just so much stronger. And we need to hold each other and ourselves accountable along the way. So our conversation today will move quickly. There are a lot of wonderful and powerful voices on this panel. It is women who deliver and deliver on time. And so I asked the audience to stay laser focused. I also asked the speakers to stay laser focused and be short, to the point, spiffy. If you want to be provoking, more power to it. And if you want to be funny, way go. We heard the names of this distinguished panel. I'm the fierce, fabulous time police. But let's just get to it. Joanne, may I? And we have decided we're on first names, because that's also part of partnerships, to get things done. So Joanne, you are leading the impressive organization Results. You've been doing that for 10 years. And it is a civil society organization that is leading across the globe when it comes to strong partnerships with governments, with other CSOs, with agencies, and also your accountability work is really solid. So this weekend, the CSOs met, a lot of the CSOs met, and came together, looked at the future, looked at what needs to get done, and came with a communique, a very strong communique. And it's really into the whole process. So would you just talk to the 3 most important points in the communique and how you look at partnerships?
Sure, can you hear me? Yeah. So just to say first that I'm really honored to be here as part of the network of civil society. There were folks from 22 countries here this weekend and that are in this room today, and more than that, that have been really driving work at the country level especially, but also regionally and globally to actually support the ambition and the success and the strengthening of the GFF. And just to kind of point like what civil society has been working toward and doing, and then I'll come to kind of the communique. First helping inform and strengthen investment cases and health financing strategies so that we focus on the things that often have been left behind, adolescent reproductive health, nutrition, and I call out to Canada for the strong leadership on both those areas, and on equity. Also supporting implementation, and again, particularly reaching the hardest to reach and creating demand from society, and advocating for increased, but also progressive and fair domestic resources, and working to support the success of this replenishment. And as you heard from Aminu last time very powerfully in the last panel, driving the tracking and the accountability, the scorecards and the rest that everyone has said is absolutely essential and an essential role of civil society. And I would say, the key points that come out of the communique in English and French, one is that this is a really key moment to take the lessons from the GFF. What has actually worked to crowd in more resources? What has worked to achieve results? What has worked to engage more partners? What has worked to date on accountability? And how do we learn from that to make the GFF stronger? But also, how do we learn from where we need to do better? And as we prepare to expand the GFF in additional countries, really applying what we've learned, I think, is going to mean more fully realizing civil society's role. So it means even more participation of people and communities in design and implementation, and then especially in accountability, and also continuing to work, as you heard from Aminu, toward inclusive and transparent processes, and also more effective support for those multi-stakeholder platforms. And I just want to say, to be provocative, this is not about looking for a seat at the table, because nobody wants to be sitting. This is about driving the work. Can I say one last thing, which is that I think something we also learned powerfully is that, and you heard it before, youth leaders, they are not the leaders of tomorrow. They are the leaders of today, and they have to be central in everything that we do.
Absolutely.
Thanks.
It's been great to see the process that's been, kind of from the beginning, where I must say I was one of those CSOs, in one of those CSOs that was kind of, really? That thing you cooked up in those offices there? Should we just embrace it? But really to see where we are today, where it is a true partnership, and the civil society organization is a partner and is playing with it, still holding accountable, still having that maybe a little sharper voice, but absolutely in the process. So great to see. Claire, you're kind of, and if I can just say it to the minister from Nigeria, watch this woman, because you are the president of the Healthcare Federation of Nigeria, and your mission is to get partners together, private sector partners, together to improve the health landscape in the country. And you've been doing partnerships, always, and very well. So can you tell us your secret sauce? What are your 3 secrets to good and effective partnerships?
Wow. I think first and foremost, it is, we must understand that there's a plethora of opportunities and challenges in partnerships. But to try and identify 3 is difficult, but I will do so. I think from what we've seen this morning, the first and foremost is political will and leadership. Today we've seen presidents, we've seen ministers of health, we've seen ambassadors, we've seen private sector, public sector, civil society sitting in the same room. 10 years ago, I'm sorry, this didn't happen, especially with private sector sitting here. So that's the first step in the right direction. That you have political leadership that is interested in public-private partnerships, that is interested and understands that private partnership and or general partnerships are the only way to unlock the potentials and change the narrative for healthcare. Now, some countries are more advanced than others. It is easy for me to walk up to my honorable minister today and be able to have a discussion, but many countries in Africa are not in the same space. So conferences like this also provide that opportunity for government to understand that the story is changing, and you've got to be able to change. Change is the only thing that is constant in life. And then now we have this open dialogue, and they have set up within their departments or central governments public-private partnership departments and put in policies to be able to engage with the private sector. The second, I would think, really is, thinking from a private perspective, is the issue of having a unified private sector, which doesn't normally exist. So being able to have an organized private sector that speaks with one voice that government can engage with. Now, when you think of private sector, government normally thinks of they're in it for the profit, that's it. And there's been a deficit of trust. But with time, by the time you can organize yourself, speak with one voice, and understand that we have commonalities, that common goal, that common ethos is the fact that when women and children are dying in your country, when children are born stunted, where each time you have challenge with non-communicable diseases and cancers are ravaging populations, that this is not the Minister of Health's responsibility, this is not government's responsibility, but is a collective responsibility. And so private sector needs to drop the differences and put those commonalities. How do we influence policy? How do we advocate and work alongside government to change the narrative? And that's what helped the formation of the Healthcare Federation in Nigeria, today the West African Healthcare Federation and the East African Healthcare Federation, and last year the African Healthcare Federation, where private sector has come together, unified with one voice, to work alongside government as a collaborative strategic partner to change the narrative for healthcare and make sure that every life counts, that we are patient-centric together. The third would be strategic dialogue, that we have opportunities as the private sector to speak with the public sector on a continuous basis. In the past, I would have to remind my Minister of Health that, sir, you're not only the Minister of Public Sector, but also the private sector. Today, I don't need to do that. We have an open dialogue that is structured, that trust has been built over time. Now, it's not an easy thing because there is a deficit from time to time, and it's important that we keep it going. So joint advocacy visits, knowing that he's not his own and we're not on our own, and knowing that at the end of the day, it's not about the 3 Ps, public-private partnership, but it's about the patient, and it's also about making sure that at the end of the day, we change the narrative. Without this, disruption is the only thing that we're sure of. If we can get those 3 things right, I think we can get success all the way.
Right.
Thank you.
Disruptive collaboration. You know, now I was supposed to go to you, Charlotte, but I'll just stay in the private sector just a bit so we don't kind of jump. So may I go to you, Marianne? Marianne, you are at the helm of the magnificent Merck for Mothers.
Also known as MSD for Mothers outside of the US and Canada.
You know, kind of what we say in Danish is that the love child has many names. So, but you work with more than 100 partners across the globe to make change, and you are very involved in and support the GFF. So your experience with partnerships from the private sector side is vast. And GFF has this multi-sectoral approach and work together across health, but also other issues, education, of course, nutrition as a core part of the mandate, but also the social sectors. So what's your secret sauce?
Why are we here?
Yeah, well, one, why are you here? That's maybe a little question, because you are invited in the front door. And, but can you just share how your organization plays to the strength of the private sector, but each partner in this?
Sure. Thank you so much, Katya. And for those of you who may not know, MSD for Mothers was created back in 2011, specifically, to bring the strength, the specific strength of the private sector to the fight to end preventable maternal deaths. Since then, as Melinda Gates said earlier, maternal mortality is actually still one of those unfinished businesses we have as a global health community. And so how is it that we're going to finish that business? It's by working together across sectors, because we know that the causes of maternal mortality are multifactorial, and thus the solutions need to be multisectoral. But I actually want us to kind of pause on that point because we can't do everything, we can't be everything, we don't know everything. And so we need to join partnerships where each of us can bring our unique strengths in these specific areas. I think we've learned that partnerships are not always easy. I think the change, as you mentioned, Claire, 5-10 years ago, where private sector was not even at the table, I think the change that we still need to see is thinking about private sector as more than just a transactional partner, but building on that trust around meaningful engagement to co-create and co-design solutions. And so I asked the question, why are we here? And we're here because we do think being a partner of the GFF allows us to do exactly that. It is, what I like to call our on-ramp to scale and sustainability. Many people, when you think about the private sector, you think innovation, so whether it's innovation in financing, how is it that you're going to actually pull in, crowd in private sector financing, because we're going to need those, to meet the SDG goals. And MSD for Mothers, we've had some experience in catalyzing some of those new innovative financing mechanisms, whether it be a development impact bond. There's also innovation in products. In order to, again, meet these goals, we're going to have to transform how we give care to meet more people. But again, how do you make sure that those transformative products get to everyone, get to each bedside? And then last but not least, I think we also have to think about innovation in delivery and service providers. Claire, you mentioned the role of local private providers. Health systems are made up of public providers and private providers. Patients are moving between the two, providers are moving between the two. So we have to actually break down those artificial boundaries that we think about when we're trying to attack this issue of maternal mortality. So I mentioned strength of private sector being around innovation. But again, there's that critical element of how we make sure innovation gets to everyone. And coming back to why we're here at the GFF, we do think that that is that on-ramp to make sure that we're leaving no one behind with our innovation. And we have been really excited that this partnership is one where we can co-create and co-design some of these solutions, because that trust comes from not just meaningful engagement and working together, but actual results and impact. And the fact that we're able to not reinvent the wheel, not redo what others have done, to identify what country priorities are, because we can pull on the investment cases that have already been developed. We can hold ourselves accountable by looking at the combined kind of impact and metric scorecards, that have been developed. We can work with civil society through the platforms that already exist. All of these things reduce our transaction cost, and make sure that we're not only making good investments, but we're making smart investments.
And be honest about it and can talk about it, yeah. Thanks a lot. I think we'll get a little back to that a little later. But now, turning to you, Charlotte, and first and foremost, warm congrats on your new job. Until very recently, you were heading DAC in OECD and being, kind of the powerhouse there, and now you're the Deputy Executive Director of UNICEF.
Exactly.
And UNICEF has been a good partner, strong partner in the GFF and in the whole global health and everywhere, the global strategy for women, children's and adolescents' health. And now you're at the helm, so you are responsible for the oversight of a range of global partnerships now. So in your experience, both from your wonderful career, but also from UNICEF and OECD, what's the prerequisite for strong and impactful partnerships? And where do you see it going? How do you hope that global health partnerships will develop over time in this particular one?
Well, thank you very much. So, building on the three examples from before, I think it was very, very good to hear. I'm new at UNICEF, so I asked my colleagues at UNICEF, what do you think about the partnership with GFF? And partnerships is not always described as something positive and easy, honestly. I was so pleased to hear three very important things that I think are prerequisites. One is that UNICEF feels that the GFF overall strive for systems change and strengthening health systems is aligned with what we want to do, alignment. UNICEF is not providing money, but feels involved. UNICEF can contribute by taking part in the investors committee, for instance, and influence the proposals with its knowledge. So being a good partner means being involved with what you bring to the table, which might not be the money, but a contribution to the quality of the work. Third thing, you build on what you can add value around to the table. So UNICEF, again, in countries where we work together, can contribute, for instance, by supporting countries to apply to the GFF, and obviously the work we do for children and youth. So there are three things that my colleagues said, concrete, I think, around why they like this partnership. And I think it's so important to have alignment. It's very important to know what you bring. It's so important, especially when we realize that partnerships is not necessarily a balanced game when we talk about power. There is perhaps always somebody who's bigger than the other in one way or another. UNICEF is big. I used to work for Save the Children. What do you think about the partnership there sometimes? You have to realize that you bring power in one sort, and if you balance power, or if you're willing to address the fact that there are power imbalances from the start, I think you can deal with them. So trust will be important for partnerships. And on an end note there, I think we can see many more partnerships succeed if we spend more time trying to understand each other's driving forces, learn about them, not be judgmental day one. I have experienced many meetings with civil society and public sector, very, very skeptical about what's the real reason for private sector to get engaged. Well, for heaven's sake, talk about it. Put it on the table. And I think we spend too little time to do that. We end up having problems later. Accountability becomes an issue, but it's actually because of lack of investment in the building blocks of trust. So, yeah.
Hear, hear. My experience is exactly, you know, sometimes when we actually ask, what do you want out of it, instead of think that they want the same as I do, and then we're in a competition, you find out, well, there's not a contradiction. We can work together, and it becomes a win-win-win-win-win. And not just for the partners, but of course for the ones we're here to serve. So, great perspective from the UN. So now we move to government. And it is a special pleasure to introduce the Deputy Minister for International Development from Global Affairs Canada, Diane Tecovella. So we know that you are very serious about partnership. We in Women Deliver feel it and know it and love it because of not just because of long-term friendship, but also because of the upcoming Women Deliver conference. So thank you for that. But you also know a thing or two about innovative financing. Financing models to achieve those big goals that we are here for and that we set. And we heard today that the GFF is the financing mechanism that can help us bridge the large financing gap on reproductive, maternal, newborn, child and adolescent health and nutrition. So how's Canada working differently to integrate innovative financing in your work on SDG 3 and 5?
Thank you, Katja. We all know, and we all talked about today, the importance that if we want to meet the ambition of the SDGs, we need more money. We need more money for health, but we also need more efficiency in the resources we already have. We had some great examples of government that committed to increase their domestic resources, because it all starts there as well. And we've talked about example about crowding in the private sector in innovative financing. I think what the GFF does, and I think that's why we were really fascinated when we had the first discussion 3 years ago about it, it's because it's using ODA to really leverage other forms of financing that were already there but were not being used for health, to be honest. But I think we need to also give credit, and Melinda Gates made reference to this earlier in her remarks. We need to give credits to the others that did some innovative financing prior to the GFF. Gavi, the Global Fund, I mean, all of these mechanisms in the past started to do innovative financing, and I think the GFF is building in. And I think the GFF will be successful if it's all of us. So the GFF, it's not just Miriam, it's all of us, civil society, private sector, governments, partners, the UN, that work together in partnership to advance, put more money, more resources to target women and girls, all that. So Canada believes that innovative financing is part of it, and this year in our budget we had additional money, but we also had a pot of money, 1.5 billion, for innovative financing. How can we use our ODA to actually crowd in different funding from the private sector? But we also feel that innovative financing is actually a tool to implement our feminist approach to international assistance. As you know, we strongly believe that you have to promote gender equality and empower women and girls if you want to achieve poverty reduction. If you don't do it, it won't work. But we need to be careful that in everything we do when we talk about innovative financing, we also involve women as agents of change. So when we develop new tools, we actually think about what impact is it going to have on women. We need to make them part of a solution, because what we risk otherwise is that those innovative financing tools actually will disempower them. So I think we need to be very careful about that. And we know that sometimes we all love, performance-based funding to drive results, but we need to be careful that the quantitative results that we're looking for will not jeopardize human rights and will not jeopardize choices. So I think we need to be careful, and I think we need to adopt a human rights-based approach to everything we do. And I'd like to highlight 4 things that I think that could make sure that the development and use of financial tools really takes that into consideration. The first one is voice and participation. We need to make sure that women are involved in the design, implementation, evaluation of all these new financial tools. We need to make sure that neglected issues that are essential to empowerment are included. And of course, I'm referring like issues like SRHR. So we need to make sure they're part of that. We need to make sure that women and girls are at the center and that we crowded the resources around them so we have an integrated approach to what we're trying to achieve. And the fourth one, as I would say, is that we need to promote gender lens investing. We need to actually recognize private sector companies that are investing in product and services that are helping to empower women and provide them the services they need. So we need to recognize that. We need to recognize companies that have more women in their leadership, more women on their board of directors. So that's part also of innovative financing.
Great, thank you. So nothing about us without us have women and girls and the people we are here to work for, have them with and instead, so at the table and engaged all the way. Never forget SRHR, and always include the different players, including not least private sector. And then I'll take the prerogative and say CSOs and young people.
And we can continue that conversation in June 2019 in Vancouver at Women Deliver.
You mean that little thing in 208 days? That's gonna, okay, yeah, thanks. So, one for all of you is that we have been discussing here over the last couple of days, but also in general, there's a lot of discussion about the international health structure, global health, and the development sector today. And now we are here, it's 3 years into the GFF since it was announced in 2015 at the Finance for Development Conference in Addis. And then going forward, if we had that crystal ball, if we could, not just the crystal ball, but also what we want to see, what is one thing that you feel hard that needs to change over the next years in how we do things with each other, but also when it comes to accountability? Nothing more, nothing less. Who wants to start? Who wants to start? You look ready, Marianne.
Yeah, I'm ready. I don't know if my mic is. Okay, now it is. So what I think we should all want to see in 3 years, and this relates to the issue of this multi-sectoral approach and accountability. Nothing should be out of scope when we're trying to address this issue. And it shouldn't be about what we think women need. And I know White Ribbon Alliance is somewhere in the house, but we should be listening and hearing and integrating what we're hearing women want. I want to see that, but not just in terms of identifying the problem and co-creating the solutions, but being part of the solutions and then actually valuing their contributions in a meaningful way. That's how you create that virtuous cycle that Melinda talked about. So thank you for giving me a little more than 30 seconds.
Perfect. So that means the rest of us stick to time. Deliver on time. Who want to go next? Claire?
For me, I'd like to see more transparency in the sharing of information, the availability, and also a different focus on human resources for healthcare, that we need to have a mindset change. In Africa, for example, there is a huge scarcity. Even in the next 10 years, we cannot close the gap between the doctor-to-patient ratio, the nurses-to-patient ratio. So we have to open our minds up to leveraging on technology and growing our own data. Data by Africa, for Africa. We have to be almost dependent on ourselves. So I really would like to see that, rather than quoting multilateral bodies, that this is really our data from our own electronic systems, and that we can say this is exactly it, and we can monitor and evaluate it, and less dependency on others, that we get it done ourselves. Thanks
a lot. Thanks. Charlotte?
So I would like then, two things. Donors out there, you spend 0.3% of ODA on data, and you speak about lack of data. Invest in data. It's easy. The other thing that I think is would be lovely to see is it's fantastic to see the investments from ODA and private sector, but it would be fantastic to see a partnership like this with more domestic resources from partner countries themselves, and even more in the driver's seat. An obvious one. Thank you.
Thank you. Dan?
I would like all the partners to commit to be all in to the GFF, that we agree to leave our ego at the door and to hold ourselves accountable for the results for women and children and adolescents.
So all in, just do it. Joanne?
Well, I would say accountability, not just for resources and results, but also for equity, which has got to be at the center of this. And the second thing I would just say is resourcing civil society fully, especially at the local level. I mean, country-level partners and local CSOs to fully do the job they can do on advocacy, implementation, and accountability.
That's great, and yep. And I will say, champion that women-centered health system, because we do know that a system that delivers for women, deliver for all. So I think we're going to make it on time. I'll just kind of close here and say we had the 3 messages. Achieving SDG 3 is everybody's business. It can't be business as usual. And don't just treat it health as health. It's integrated, break down the silos. And when we work together, we are much more than the sum of the parts. It can be hard, and let's be honest about that. But let's also talk to each other so we know what the win-win-wins are. And even the best laid plans need to be assessed and measured, and we need to hold ourselves and each other accountable all the way. So we hope that you will carry those messages with you throughout the day, but way beyond, and take them home and put them into action. We need all of the voices here, we need all of the sectors here to make sure that we get strong, effective, accountable partnerships, and that becomes the name of the game in health and way beyond. So with full commitment from this room and this panel, I'm sure that we will reach a new normal and achieve health for all. So at Women Deliver, we have this little saying. It is, we work hard, we change the world, and we have a little fun with good partners while we do it. That's also a good ingredient in good, effective partnerships. So when you want to have some more fun, I'll see you in Vancouver for the Women Deliver 2019 conference. Thanks a lot.
Thank you very much. What an excellent panel and such excellent pragmatic suggestions. Thank you very, very much. Ladies and gentlemen, we are slowly drawing to an end of our day, the last panel, but it's an absolutely crucial panel entitled Investing for Impact, the Future of Global Health. These will be the last thoughts you will be left with today, aside, of course, from the Norwegian minister's last parting comments. This panel will be moderated by Gitinji Gitai, who's here. Yes, please join. The CEO of AMREF Health Africa, co-chair of UHC 2030. And his distinguished cast includes Seth Berkley, who's the CEO of Gavi, which has been mentioned many times, the Vaccine Alliance. Mariam will join us again, Clausen, who's the Director of Global Financing Facility. Annette Dixon is here. I saw her coming in. Vice President of Human Development at the World Bank. Natalia Kanem. Finally, you get up here, Natalia. Under Secretary General for UN and the Executive Director of UNFPA. Nicolas Meda, I think he's with us. He's the Minister of, oui, bonjour, Minister of Health from Burkina Faso. Et puis, the final, Carol Prechern, who's the head of the Office of the Board of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Welcome to all of you. Bonne arrivée.
Hello, hello, hello. Good. Thank you very, very much. We have everyone here. Yes, Honorable Minister. Please stand up, because we've been having a very long day seated. So please stand up, if you don't mind. Stand up and stretch. This is the last panel, and we know how difficult it can be to keep you awake. But luckily, I have the best panelists of the day to make sure, because we knew some of you would be sleeping. I've seen some of you yawning. Please do so easily. So I also want to make the biggest pledge of this conference, of this meeting, the biggest pledge to GFF. We have $1 billion, but the civil society is committing to go raise all the money needed through domestic resource mobilization. So that's our pledge. So to make sure that we meet this. Civil society, are we here? Are we committed? It is us to raise the rest of the money. We appreciate all the money put together, but now we have to go and raise the rest of the money back in our countries. Thank you very much. That's the biggest pledge to GFF. Thank you. Please take your seats and feel free to stand. Now, we have a great panel here. As you can tell, I'm restless because I'm excited. So I am going to ask Natalia Kanem, who is the Executive Director of UNFPA, to make some remarks from the podium because she needs to leave. And for me, I want her to kind of look at, looking forward, where do you think the partners can accelerate progress for action, as you say within UNFPA, to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled? How do we get along this message to achieve SDG 3? Thank you. Over to you, Natalia.
Thank you. Thank you so much, Dr. Gitinji. Excellencies, honorable ministers, distinguished participants. Somewhere it is midnight, and there is a girl in labor. I wouldn't call her a woman because she's 15 years old. Will her family be able to afford the transport to get her to the next village over? Will the midwife be there? And if she's there, will she or he have been properly trained? Will that person be in a position to save the life of this young woman? And will we get to hear the newborns cry? When we talk about investing in health, we're talking about the mother, the sister. We're talking about the reason that GFF exists, and we're talking about the reason that we're all here. So I would say the investment proposition is, in fact, woman-centered, and that in the cycle of life, from prenatal care on through to old age, being woman-centered leads to all the benefits that have been discussed. And I just want to highlight two concerns: equity and quality. For me, those are the two biggest challenges in the road ahead. And as we think about leaving no one behind, the commitment is to reach those who are furthest behind first, with a type of quality of care that is going to make a difference. To understand the needs of those furthest behind, and I speak of adolescents, anyone who is poor, women with disabilities, indigenous people, fistula survivors, any isolated community, whether it's a mountain, an island, or whatever the difficulty may be, we need strong health information systems. And we heard that throughout every panel today. This means data, good data, self-generated data, with which countries will base their decisions to implement evidence-based strategies that work in all the dimensions of the health system. And while we may each have our own specific niche area of focus, it does take partnership. And what is critical is that this partnership be complementary, that the right hand and the left hand know what each other are doing, and that we use our resources and we use our expertise collectively, efficiently, to support national government initiatives to invest in these high-quality health systems, because we must deliver on the promise of good health for women and girls, for every woman and girl on the planet. And it's about choice. It is about universal access, and it's about quality. I have to note that the shrinking space and the harshening political climate on sexual and reproductive health and rights is not the positive direction that we need to move in. So it requires leadership. It requires the understanding that we have to maintain and to advance the health and well-being proposition for millions of women and girls who are still waiting for fulfillment of that unfinished business. Young people in particular need the opportunity to be able to express their sexual and reproductive health and reproductive rights, standing firm on evidence and using approaches that apply the highest of human rights standards. This is going to be crucial, and at the very minimum, we have to hold our ground. To get there, we need to build on existing efforts, we need to have new efforts, and all of us have to work together to ensure that there is a place where we listen carefully to what it is that the women themselves are demanding. None of our commitments to maximize our collective value proposition, to leverage our capacities, to unlock innovative approaches will have any impact unless countries lead, and we've seen country priorities today. These interventions all have to be scaled up. We're actually talking about numbers in the millions, and therefore, we at UNFPA congratulate GFF for taking a step forward. And I would like to thank you for your leadership where you are, insofar as we are producing the results that spell the difference. I look forward to celebrating with the Secretary General's Every Woman, Every Child initiative and that global strategy, the type of partnership and momentum next year, which is the 25th of the International Conference on Population and Development, ICPD, plus 25. I look forward to celebrating, hearing that newborn babies cry. And more than anything, I look forward to celebrating a world in the year 2030 where family planning will have been brought to the doorstep of every woman who wants it, where the trend in maternal mortality will continue to go down to the acceptable level rather than the 832 women per day where we stand now, and where sexual and gender-based violence against women and girls in all its forms will be a thing of the past. We can do this. Thank you very much.
Thank you.
Thank you,
thank you. Thank you very, very much.
Thank you.
A big hand for her. So thank you, Natalia. Thank you for accepting to make those remarks. Now, as you can see, this panel is about the way forward. We've spent the last few days talking about civil society spent 2 days here. Then yesterday, we talked about domestic resource mobilization and its use. During the day, we've talked about different aspects of efficiency, equity. Now, this panel that I have here is going to discuss the way forward. So, ladies and gentlemen, prepare yourselves to hear about the future. The past has been achieved. And congratulations, Miriam, for the replenishment activity. So I would like to go straight to Annette Dixon, who is the Vice President of Human Development at the World Bank. Annette also has a long-standing history of championing gender issues. And the World Bank has recently, through the leadership of Jim Kim, talked about the human capital agenda. How do you see the World Bank's human capital agenda linking with the GFF for women, children, and adolescents? So.
Well, thank you very much. And as my awesome boss, Kristalina Georgieva, said this morning, we now have even better evidence about something that I think we all in this room have known intuitively, that investing in human capital actually is capable of not only improving the lives of individuals and their families, but actually propelling the development of whole countries. And so to really shine a light on this, we've launched the Human Capital Project. And one of the things we all know is that you pay attention to what you measure. And so we've developed a new Human Capital Index, which really is highlighting those aspects of human development outcomes that are critical for productivity and growth. Where there's a clear evidential line of sight between investing in the outcomes of an individual, child, and her health and her education, which in turn will increase her productivity and contribution in later life, and when aggregated, actually can take countries forward. So this index has been launched for the first time, and it ranks countries based on their outcomes in health and education that are in the index and for which we can measure things across a large number of countries. And actually the reaction, we launched it at our annual meetings just very recently, and the reaction was tremendously positive. And what it has done is really, I think, given ministers of finance, planning ministers, and the top leadership of countries a sense of the urgency of investing in people, because part of the problem of investing in human outcomes, human development outcomes, is it takes a long time to see the results. And so sometimes it's politically more attractive to invest in things that you can see results more quickly. And that really, I think, we hope that will actually help countries to see the importance of investing themselves in their people. And of course, those of us in the international community can partner to help that happen. But it's not only the amount of investment that countries are making, it's also the effectiveness of those investments. Because we see, on one hand, some countries under-investing because they're neither mobilizing resources nor giving priority to these things. On the other hand, we do see countries that get that it's important, but are still struggling to get the results. And so we really see countries stepping up across the board. And even advanced countries are saying that this agenda is important because their young people need to be even better prepared for the future world of work. Now, I think, we recognize this is an agenda for all countries, but when we look at the countries that have the lowest human capital outcomes, these are the countries where we see young women having children way, way, way too early, having too many children. Their children and they themselves are at peril because they're having so many children so young. These are the countries where maternal mortality rates are high, women are dying in childbirth, where the risk of their child surviving to 5 is very difficult for them, the children that are stunted. And so it's a kind of a way of really, I think, highlighting when we look at extreme poverty rates, we look at the countries that are at the bottom of the Human Capital Index, and when we look at their fertility rates, we see a whole bunch of things that come together into a very difficult picture. So I really think that for the GFF, these are the countries where we really have to focus our efforts to help these countries make these critical investments which are going to make the difference as to whether their countries actually get on the right path to achieve what we call the demographic dividend. And that's that sweet spot where your human capital, your education and health outcomes are getting better at the same time your population growth comes to something which is manageable and which you can get to the point where your economic growth is faster than your population growth, because you only get living standards improving in a country, you only get poverty reduction when you get that human capital boost. And we know that from the countries in Asia that have all done this and have been very successful.
Thank you. Thank you very much. And I think, a big hand for, and I think you're talking about long-term investment for human capital. And I'll come back later after we talk about Gavi and Global Fund and ask the Minister of Burkina Faso, because Burkina Faso has kind of is investing in healthcare. And we know that the political cycles are as they are by the calendar. What is it that the political system in Burkina Faso has seen that actually the long-term investment is also going to give them short-term gains? So I'll come to you in a minute, because I want to bridge this first with what's already existing. You know, we have a lot of activity, Global Fund and Gavi going on. So I probably want to first ask Seth from Gavi. Gavi has done a lot of work, saved millions and millions of children. How do you see the priorities of Gavi, the current ones, aligning with this, with the GFF and the future for greater impact and accelerating the progress? So you could just comment on that, and then we hear from Global Fund, then we get back to Burkina Faso.
So thank you, and I like the idea of looking forward, but I want to look back for a second and remind everyone in the audience how much incredible progress we have made. So if I look at the area that we're concerned about, you know, we have a 60% reduction in child mortality rates. Now, that's not good enough. We understand that, and we've heard the statistics, but we have done a lot. So you all know I'm obsessed about vaccines, and my job, of course, is to make sure that we work with everybody involved with vaccines. And what's the good news there? Well, it's the highest coverage in history now, but of course vaccines don't deliver themselves. And so when we look at the first dose of a DPT-3 containing vaccine, more than 90% of children in the world are getting that. That's great news. Third dose, 85, 86%. So that means 14 or 15% are not. But that's where we have to obsess now. So although you talked about the countries that are at the bottom of the list, we need to think about this in every country. The question is, how do we help countries build resilient public health systems and focus particularly on the places that have the worst outcomes? That is really the name of the game. And how do we get countries to be convinced, in the sense of allocative efficiency, that they should focus on the places that have the worst outcomes, they should focus on prevention, and they should focus on areas that need that coverage first? So that's the name of the game. And obviously, we need to do this working through country systems with everything on budget. And we need to share those systems. Those systems aren't just for vaccines, or as I'm sure Carol will talk about, for AIDS, TB, malaria. They need to be for all interventions. We need to build data systems. We heard that in the last panel. That's why we work with the University of Oslo to create the DIS, to bring the DHIS system to now more than 50 countries, so that we have one shared system that can be used. But what we've also heard is there are many missing interventions. There aren't enough commodities. It's a tragedy today if we don't have family planning available. There, are hundreds of millions of women who want that. We don't have the tools to do maternal mortality, and that's why I welcome so much the exciting results here today to replenish the World Bank GFF Trust Fund to make money available for these areas that need to be funded. Because one of the most frustrating things, you give a vaccine and then the child dies of another disease or the mother dies. That's not the way it ought to be. So what do we need to be thinking about, though, is not just in looking forward the different interventions, but when we look, and we heard earlier about the crisis in human resources for health, that's not immunization people, that's not maternal mortality people, that's not TB or HIV people. This is about strengthening that system across the entire system. As countries have decentralized now, and they have weak health workers in those communities, that's about strengthening those workers for all of the diseases and the systems that need to be done. And of course, the pressures that are changing, urbanization, climate change, et cetera, are going to put further stresses on the system. So I think as we look forward, what we need to do is focus on the things that we do and do well and help countries do that. But we need to take a look at these cross-cutting issues in a different way. And that's why we welcome the SDG 3 roadmap. We welcome the work that UHC 2030 is doing. How do we come together around these cross-cutting areas and support countries and invest in those countries and get domestic resources to make sure that we can deliver all of the interventions? Because at the end of the day, we want people to be healthy, not just free of one disease or another or another.
Good. Thank you. Thank you. Thank you very much. And by the way, I like your socks, Seth.
I like your socks.
Okay, good. I now want to kind of get on to Global Fund, because I think we've had a lot of the global health initiatives going on, and the investments have been going on. You've talked a lot of the progress made so far. And we have also seen a lot of progress in HIV, TB, malaria through the Global Fund. But I would like to ask you the same question so that we give the minister the chance to respond about where does he see the current landscape and where does he see the future, and how do we mix these two, and what's the role of that ministry? So from the Global Fund, could you also answer to me the question of how do you see your current successes and how you're going to share that with the partnerships that are emerging with GFF for greater impact and acceleration of progress?
Thanks a lot. I like your jacket, by the way. People that have heard me speak before know I use a lot of obstetric terminology. It's my kind of midwife roots. So a bit like Seth, I want to just look back briefly. I was around at the conception, birth, infancy, and adolescence of several of these institutions. Fortunately not the World Bank, that would be a bit worrying, but Global Fund, Gavi, and now GFF. So when we're looking forward, the people will know that the Global Fund just published a report where 27 million lives saved. And of course, those lives saved are not just Global Fund successes. This is the collective, this is the partnership, it's the collaboration between multiple people. So when we're looking forward to what we could do better, more of, together with the GFF, with Gavi. I was tempted to just say, like he said, ditto, let's move on. But I'll be brief. I think around the health system space, the resilient and sustainable systems for health, this is an area we're all working in. We've heard from many ministers, civil society voices. It's always a challenge. But I think if we're really to have impact, if we're really to go forward on this collaboration, which is now being crystallized also through this global action plan and roadmap, we have to really crack this nut, because as Seth has just said, it's not immunization health workers, it's not people just doing safe deliveries. So we're all investing, we're major investors in this space. So to come around the country investment cases, obviously taking the lead, as we all do from the national planning process, but to be full and equal collaborators in those investment cases to make sure that we are truly complementing, not duplicating, and ultimately getting to where we need to be, which is away from those 832 deaths a day or the unimmunized children. I'm going to fast forward on a lot of things, which I think you'll be happy for, because I can see this clock in front of me. But Seth and others have mentioned, and Mariam and many yesterday, I actually listened to the IMF, which normally when an economist starts speaking, I tend to fall asleep, but I actually listened yesterday, and the allocative efficiency thing, which doesn't really trip off the tongue, but in my brain that just translates as doing more better with the same money, not less. We should be investing the same money better together, and that's where I think Global Fund, Gavi, GFF, many of the people in the room can be having much better conversations about how we really do that, how we get the quality, how we get the forward progress. In our involvement in the GFF, we are on the investors group. In many ways, and I was going to say, we're about to go into a Global Fund board shortly. There are many of the same partners around the table. I would like to see that forum become really a much stronger forum for learning those lessons, really being very honest about where we have made success, where we could do better, how we can collaborate much more effectively. It's not a problem, there's not issues, but I think we could just take some reflection in that space. I think maybe I get a chance at the end to talk about some final thoughts, but we are all sort of servants of our boards, and one of the unique features of the Global Fund Board, the GFF Investors Group, the Gavi Board, is that everyone is represented around that table. We have strong and powerful voices, but you often hear the Global Fund should do this, Gavi should do that, the GFF should do this. There are the same investors, the same stakeholders, so I'd like to see the boards coming together when we're mapping the way forward to have a really strong, coherent voice on how we really crack this nut or deliver this baby or whatever on the midwifery analogy theme.
Yeah, I like your language. I think I didn't mention to you that Carol is a trained midwife and an anthropologist. You can hear that in the language as well. Now, I want to come back to the Honorable Minister. You have obviously been working with all these agencies, and now we are looking to the future. How do you see the role of the GFF mechanism in global health financing in the future compared to where we are now? Looking at Burkina Faso specifically. So, over to you.
Thank you very much, and perhaps allow me to address the conference in French.
That's fine.
Okay, thanks.
Yes.
Thank you very much. We aim at reaching an impact, and more importantly, we wish to reach a long-term impact, and we want to do that with GFF. Now, in order to have an impact, you need a political leadership that is in tune and, of course, at the highest level of the country's decision-making forces. Now, Burkina Faso is giving an example here, and this is an example that could be copied by other countries in order to move more swiftly forward. But you're not asking only about moving forward fast, you're also asking about what options we have to move forward and to be sustainable. And that is why we are trying to speak with one voice at the state level, i.e. the civil society organization, the various partners, the private sector, the public authorities. All stakeholders need to get together, sit around a table, and decide what to prioritize in terms of maternal health, in terms of newborn health, in terms of the child's health, the adolescent health, or in fields of nutrition, for instance. It is only through a collective approach that we will reach empowerment of all and make some progress in maternal and child's health. In order to improve in this field, taking into consideration the specific situation of our countries, we need to go for a community approach of health services deliveries. You know, when we inaugurate a special health institute of tertiary services, tertiary health services, we're very pleased to hear the news, but a very small proportion of the population has access to that kind of establishment. And we need to solve most problems of the population at the level of primary health care. 80 to 90% is solved. That is the only way for us to go the last mile. Now, thanks to new technologies such as digital health, we enable somebody to have access to a medical specialist wherever in the world, as long as you have access to Wi-Fi or to the internet. It's possible for a specialist in a different country to interpret an X-ray, for instance, or some symptoms. So anyway, whatever we do we do things better if we work with other sectors that are active in development. The health sector cannot on its own solve all health problems or all education problems. In Burkina Faso, we know that 60 to 70% of the population is illiterate, and it is only through education that we will be able to educate. And once people are educated, messages can be understood better, and the awareness of what health is all about will be much better understood. For instance, water, healthy water, or sanitation. Who deals with that? It's not the health ministry. It's other services that deal with that, or the road infrastructure. But if all sectors work together, a multi-stake approach will provide better results. And GFF is actually asking us to mobilize domestic resources and use them. At present, in the Sahel area, we're suffering from a security problem, and a lot of the national resources are used to take up the security challenge. And now we are asked to actually move on, possibly tax so-called sin products. Well, that is one option indeed. Why not actually tax so-called sin products? This will indeed improve the tax bases available. Now, my last message concerns the inclusivity or inclusive approach. People have been talking about mothers, young women, children, but men, too, can certainly help the agenda of women move forward. Now, men can be an obstacle to women, but unless you include men, once the woman goes back home, the man might say, this will not be done this way because I don't truly understand why it's so important. And therefore, including men in the work which is done in order to improve maternal and child health is necessary if we want to move forward. So let me sum up and say that we need a leadership at the highest possible level to accompany the efforts that are being made, a multi-sector approach, and further innovation is really necessary so that we can move forward with a major focus on civil society and on community. Thank you.
Thank you. Thank you very much. You raised very critical points. One of them, obviously, being that health is made at the primary health care. And I heard in Astana someone say that health is made at home. Hospitals are garages for repair, where the mechanics are the doctors. So we're basically saying take health down to the people and then create proper pathways. I want to hear from Michelle. Michelle is the Assistant Director General at the World Bank, ADG for external, at WHO, at WHO. And yes, at WHO. And I would like to hear, because obviously, again, you have a wide experience in health diplomacy. Next year is probably the biggest year for global health diplomacy. We have the high-level meeting on UHC next year. We are waiting for the Global Action Plan to be launched in September, which you've heard a bit about here. So how do you see these moments changing the landscape in acceleration, in impact, and also starting from what you've had in the last 2 days? So over to you from a WHO point of view.
Thank you very much. Thank you so much for having the opportunity to speak this afternoon. As you know, WHO is committed to support the fundraising efforts of other global health actors. And it was really great to see the success this morning and the strong set of commitments. When we invest, we expect a good return for that investment. And if our investments are fractured, they're fragmented, and if the efforts of all players are not coordinated, then we have a problem, which is why we started launching with all partners that are here actually around the table, the GFF, Gavi, the Global Fund, the World Bank, and others, this global action plan for SDG 3. It's 11 global health agencies aligning. You remember the words we use yesterday: align, accelerate, and be accountable, account. So that's what we want to do. We want to align our policies and practices to pursue innovative ways of accelerating process to develop a common framework for assessing and for accounting our collective contributions. As you know, the first phase of the plan has already been completed, and we have the sort of nucleus for it. We have the full engagement of 11 heads of agencies. We have established our common vision and our commitment for an initial set of actions. We have defined accelerators and milestones, and we also have a strategic and inclusive development of a global plan. Now we're going to move for next year into phase 2, and that's what 2019 is going to be for all of us. It's really political engagement, political commitment that you just mentioned, Mr. Minister. We need to have that political commitment. It was affirmed at the World Health Summit in Berlin and also in Astana. It continues here in Oslo, and we will continue throughout the year next year. At the discussions we had at the DRUM conference yesterday, we had clear demonstrations of the health minister's interest into this global action plan, but we also heard the call to ground it, to ground the global action plan in country realities and to gear action towards really helping countries overcome the challenges they are faced and accelerating together towards SDG 3 and other health-related targets. So the phase 2 now is going to provide this opportunity for all stakeholders at national, regional, and global level to share their ideas, to co-create solutions, to crowdsource in bringing innovative ideas, and to help the global health organizations prioritize these actions which matter most at country level. This has to be country-led and country-owned acceleration. The main focus then of our engagement is going to be the accelerators area, for which there is a really potential significant acceleration and change possible related to SDGs. And that includes sustainable financing, which has been a focus of the conference yesterday and today, and of course, civil society and community engagement, because they are the people working at country level we need to work with. So really the aim of the plan now is to accelerate the collective impact of us, global health organization, and much more effectively supporting countries and people in particular by working in a much more collective way to collectively prioritize, to invest, to program, to measure progress, and to be accountable. So this full plan will be launched next year in September at UN General Assembly, and then the rest of the year we will go full-scale implementation of this plan. So we will work as a collective of partnerships. We will put the plan together into place by putting the weight of joined-up multilateral system behind the national efforts and to accelerate progress. So really 2019 is going to be an exciting year. We look forward to traveling it with you. We know the price in terms of health outcome is high, but the cost of inaction is far greater, and we must walk the talk together.
Great, thank you. Thank you very, very much. And it's very clear in this the accelerators, you talk about sustainable financing and you talked about civil society, because I think sustainable domestic resource mobilization has to be very closely tied with the people and civil society action in the country. Now, Miriam, a great day for you. It's been a very busy time, I know. So I would like to hear, from you. Here we are now, fantastic day. How does this look 5 years from now? That's after you've recovered from all this and you've taken a few days of rest. What do you think about the next 5 years of GFF?
Thank you. 5 years from now, when I talk with Minister Meda, we will be discussing the quality of those services on the front lines that he has built, that integrated community platform that folks are accessing, but what are the qualities of those services? That will be the center of our conversation. When I meet with Amino, a few years from now, he'll be telling me whether the finances are actually getting to the unpaid health workers at the local government areas, and he will know where the money is actually flowing. So in 5 years from now, of course, this scorecard that civil society has been sharing with us, which still has red and yellow for civil society engagement, will of course all be green. And actually, it shouldn't take 5 years for those to turn green. They will be green in a year from now. So most importantly, 5 years from now, we will be started talking about what Seth talked
talk about, the coverage of high-impact intervention across RMSH. And we are not just going to be discussing whether, the access to antenatal services or the access to skilled birth attendants. We'll be talking about the quality of those indicators. And we'll do that within 3 to 4 years. In 5 years, collectively, if we are successful across all stakeholders here, countries will start to bend the curve on the SDGs. We will be starting to see actually trends in maternal mortality, child mortality, newborn mortality significantly start to go down. We will start to see changes in stunting rates and antenatal birth rates. Some things that you have to keep us in the GFF with the partners, financiers accountable for is that we have to start to be able to report to you within 5 years whether health expenditure per capita financed from domestic resources have significantly changed. We should be able to tell you whether the ratio of government health expenditure to total government expenditures have changed. We should be able to tell you whether the proportion of current expenditures, how much of that is actually going to primary health care. And we should be having a discussion, an informed discussion with you about the incidence of financial catastrophes as a result of out-of-pocket spending. We should be seeing a reduction in out-of-pocket expenditures. So I think, Gigi, since I may call you that, that we will have a different dialogue in 5 years from now around where the money is going, where it's flowing, what it's paying for, and we would have shift to what some of us refer to as the frontline first rather than the last mile, what's happening out there across the boards, and we should have a very substantive discussion around the coverage of high-impact interventions across the spectrum, reproductive, maternal, and newborn, child and adolescent health, and nutrition.
Great, thank you very much, and I think that's a really good point to end it there. Really, really, really good point. And please take a rest. It's been a great time for you. We really appreciate your energy that we've been seeing going around. And now we have to come to the end of this panel. And I would like to say that 14 years ago, a woman from Kenya stood in this hall to receive the first African female Nobel Prize. Her name was Professor Wangari Maathai. She said, and I quote, "In the course of history, there come a time when humanity is called to shift to a new level of consciousness, to reach a higher moral ground, a time when we have to shed our fear and give hope to each other." That time is now, ladies and gentlemen. A big hand to the panel. Thank you very much. Thank you.
Ladies and gentlemen, mesdames, messieurs, tous nos invités
Ladies and gentlemen, distinguished guests.
Our day in this exquisite setting. Money was pledged, and generously so. New friendships were forged, old partnerships renewed, and in the margins, some critical conversations, and they're crucial. 2030 is not that far away, and the road to it is still long, still rocky, and in some countries that road is not even paved. But let today be a marker that stays in the memory and an affirmation, if one was needed, that men, women, and the young generation have to work together to prioritize the health and well-being of women, children, and teenagers. Your carriages are waiting outside Oslo City Hall to take you back to the lives that you lead, that will continue to fight for all that we've discussed here today. But let the last word of the day be to our distinguished host, to the Minister of International Development of Norway, Nikolai Astrup. Please welcome him.
Excellencies, ladies and gentlemen, dear friends. Many people are pronouncing the death of multilateralism. Yes, there are clear grounds for concern. The political landscape is far more challenging than it was just a few years back. We are finding that we have to fight increasingly hard, not only to push the agenda forward, but also to protect long-established achievements. However, during these 2 days in Oslo, we have proven the doomsayers wrong. Despite the many challenges, multilateralism still works. Perhaps even more importantly, it works in a new, smarter, and more innovative ways. Thank you very much, Lies, for your excellent management and moderation of today's Replenishment event. I would also like to ask everyone to give all our speakers a round of applause for their excellent contributions and the insights they have shared with us. We started with beating the drum, the Development Financing Conference yesterday. Today, we have taken part in an inspiring and successful GFF replenishment event. We can be proud of the great collaboration that is underway to improve the lives of millions of women and children across the world. We have taken the way we finance health and development an important step forward. This model is now being implemented on a greater scale, with greater efficiency, and with country leadership and domestic resources at the center. This morning, we heard from Prime Minister Solberg about how Norway's support for the GFF ties in with Norway's global health vision. From President Kabore, we heard how the GFF partnership is working with, not just for, Burkina Faso to make a change in health and nutrition. Kristalina Georgieva, CEO of the World Bank, talked about how the human capital agenda and the GFF can help to drive commitments and investments at the national level. Finally, Melinda Gates spoke about the importance of prioritizing women and girls in development. I couldn't agree more. The GFF is a partnership, and the commitment of its partners, countries, multilateral and bilateral donors and agencies, civil society organizations, and the private sector, is what makes it so strong. During the afternoon panel session, we heard how country-powered investments are critical to development. We heard how partnerships are evolving and how we can increase accountability. We have made great progress over these 2 days. Firstly, we have raised more than $1 billion, which will go a long way to transforming the health and nutrition of women, children, and adolescents, and will enable the GFF to expand towards the milestone of reaching 50 countries. Secondly, Burkina Faso, Côte d'Ivoire, and Nigeria have demonstrated that countries are stepping up, putting more of their own money on the table, and investing in the health of their people. Thirdly, we are thrilled to see 10 new investors contributing to the GFF replenishment. The governments of Burkina Faso, Côte d'Ivoire, Denmark, Germany, Japan, the Netherlands and Qatar, the European Commission, an anonymous donor, and Lardal Global Health. Fourthly, the Bill and Melinda Gates Foundation, the governments of Canada and the UK, and my own government have all confirmed their continued support. Today we have come a long way, but we have more work to do. We have all seen the impact that the GFF partnership can have. Let's make sure that we don't stop here. Let's continue to invest in the months and years ahead so that the GFF can reach all the 50 countries with the greatest needs and transform the way they invest in and finance the health of their people. Once again, thank you to everyone for coming to Oslo. Thank you to Marianne Borgen, the mayor of Oslo, for your wonderful hospitality in this great room. To our GFF replenishment co-hosts, Burkina Faso, the World Bank, and the Gates Foundation, thank you for your determination in driving this critical process forward and for your commitment to the GFF. To the donors to the GFF replenishment and to all the countries that are partners of the GFF, you are acting as a catalyst to improve the lives of millions of women and children across the world. Over these last 2 days in Oslo, all of you have really banged the drum for every woman, for every child, and for every adolescent. Let's all keep banging the drum. Thank you so much. Have a safe trip home.